Good morning and welcome to the Independent Republic of Mike Graham right here on Talk Radio. The week continues to become more and more ridiculous. Yesterday afternoon, the government announced that London would move into Tier 3 later on tonight, leaving thousands of restaurants and pubs bereft. Thousands of places where expensive food and drink has been stockpiled for the Christmas season. Thousands of places that employ many more thousands of people. Thousands of places that are the lifeblood of this country, where thousands of people meet to talk, to congregate and to enjoy themselves safely. My question this morning is this: what has Boris Johnson got against these establishments? What has he got against the great British habit of eating and drinking? And why does he have it in for thousands of people who make their living out of serving other people food and drink? Once again, I say this is nothing to do with anybody's ability or wanting to go out and get smashed. It's got nothing to do with people wanting to enjoy themselves. This is all about a business which is the lifeblood of this country, which contributes billions and billions and billions of pounds of tax revenue into the government coffers. And yet, for some reason, Downing Street seems to hate hospitality. Is it because they have no clue about ordinary people? Is it because they have no clue about what people actually want to do in this country? Is it because they are so out of touch with the common man and woman of this country that they simply don't care? It's all based on supposed data, right, from PSR tests, which are questionable at least and wrong at worst, right? Can we please just get some proper scientific analysis of what is going on out there? Just because a couple of parts of London are seeing so-called increases of positive tests in schools, there is absolutely no need to shut down one of the biggest and most important cities in the world, because that, ladies and gentlemen, is precisely what has happened. If you're affected by this latest madness, please do get in touch. We need to hear from you. 0344 499 1000. Last night's media briefing from the increasingly unconvincing Matt Hancock included the nonsensical notion that GPs are now able to give out the COVID vaccine, when that is clearly optimistic at best and wrong at the worst. Doctors are already complaining that they have had to cancel appointments because the vaccine simply didn't arrive. Other doctors have said the government red tape is strangling their ability to carry out tests in order to release people from quarantine. We heard that from Lawrence Girlis yesterday. We'd love to get the Secretary of State for Health on to answer our questions, but so far we haven't really had any luck, unfortunately. I wonder whether Matt Hancock only thinks it's okay to talk to the press and talk to the media sometime before sort of 10 o'clock in the morning. Well, I'm sorry, mate. You need to talk to us all day and every day, and you need to justify what it is that you're doing and what the basis of your doing it is. 0344 499 1000. We'll be talking to restaurant owners, we'll be talking to brewery managers and other hospitality industry people as well, and we'll get the latest on Brexit too. You're listening to me, Mike Graham, on the fastest growing radio station on the planet. It is, of course, Talk Radio.
Mid-morning with Mike Graham. Talk Radio.
Let us kick things off immediately with Professor Carol Sikora, former head of the WHO Cancer Programme, Dean of Medicine at the University of Buckingham. Carol, a very good morning to you. Welcome.
Morning, Mike.
The papers this morning full of the sort of two stories, I suppose, which are the most important ones. One, this new strain of coronavirus, which frankly doesn't appear to be worth the paper it's written on. And secondly, the Tier 3 lockdown for London, which also, I'm afraid, doesn't appear to be backed up by any sort of serious health and safety data.
Yeah, I have to say, I'm with you on both those. Let's take the mutation. Viruses mutate, we know that. That's not the significant feature. This virus mutated way back in April. Throughout the world, it changed one of its building blocks, its amino acids on that spike protein that children like drawing. And it didn't really change its behavior at all. It changed again in the last month. One amino acid, that's the building block of a protein, changed for another at position 501. So what, as you say? I think it was thrown in by Matt Hancock to sort of try and justify what he's doing with Tier 3, which is crazy. You can't use that to justify, but it's scary to think these mutants are out there. You imagine these old science fiction films and mutants coming down the street for you, you know, the stuff of nightmares. It's not like that at all. As for the data, I mean, you know, I look at the data every day, the government data. They put it on coronavirus.data.gov, and you look it up, and it is pretty poor. First of all, it's not timely. It doesn't come up at 4 o'clock every day. It does sometime. Secondly, there's a huge weekend effect. The data just gets completely messed up. So it's no coincidence that the total number of people said to be in British hospitals is the same for Saturday, Sunday, and Friday. I mean, it can't be that they're exactly the same to the nearest one patient. They've got to have changed over the weekend. And yet that's not recorded for a variety of reasons. But, the only justification for increasing the stringency of control of us is if the hospitals can't cope.
Yeah.
And at the moment, when you look at the data, it's flat line. It's not going up significantly. There are about 12% of all hospital beds in the NHS throughout the UK are occupied by COVID patients. That's all we can say. But it's winter. That's what happens every winter. Patients with all sorts of chest disease, mainly older patients that fail on antibiotics in the community, they come into hospital and they're there. So what's different this year? And, that's the problem. Are we making too much of a fuss? I really sympathize with the guys in the hospitality business. My daughter works in it, and it's a complete mess.
Yeah. Well, I was just saying to Julia, I was in a restaurant yesterday afternoon, having a business meeting with somebody, very important meeting, very important lunch. And the people that were around me, I thought to myself, these poor people who work in that business, right? Most of them were obviously Europeans. They spoke with accents, they were all very good. But all the people that were waiting, all the people that were behind the bar, everyone there was obviously on a relatively low wage, but they were doing their best to work their way through whatever it was that they needed to do. And I thought to myself as I walked out, I said, I really feel sorry for you guys because tomorrow you're going to close and you don't even know when you're going to be able to make any money again.
And a lot of these guys don't get money unless they do something.
Right.
I mean, it's a gig economy out there for them. It's all right for the public sector. The epidemiologists sitting in their nice lectureships in universities for their nice pensions to come make the rules. Same for the politicians. But these guys are at the rough end of it. And it's not just them. It's all sorts of service workers in the city that, every industry has another one behind it that needs people to service it. So the number of jobs that are going to go over this most incredibly busy period for the hospitality industry, I'd just love to see the data. And if you ask for the data, it's as though you're doing something naughty in church. You're asking if you believe, does God really exist in the church?
Well, that's right. And this is the thing: if you don't believe it or you ask questions about it, you're immediately castigated as some kind of demon who must obviously follow some mad conspiracy theory. Absolute nonsense and rubbish. And the more I watch Chris Whitty, and the more I see of the way that these people actually roll out some of the information they give us, the less actual confidence I have in the fact that they're telling the truth. Chris Whitty looks increasingly to me like some kind of weird, odd character who's never actually stepped out of his house ever to do anything other than to stroke a tortoise or something. I mean, he's a very odd looking guy.
No, well, that's not his fault, but he's actually a very good public health guy.
Is he? What's your evidence for that?
Well, with Ebola fever, this is not, of course, Ebola fever. That's where he cut his teeth on epidemiology.
Well, I don't remember being threatened by Ebola in South London, a few years ago, and he seems to think that this is just as bad.
That is the problem. They've taken it to heart and they're going on, but the numbers are not going up. They went down on the 2nd of December, and it's as though we were out of it on the 2nd of December, which would have saved all this. Instead, they've started going up again, but they're plateaued. So I can't believe they went in so quickly. And it was a typical way of doing it. Drop the information over the weekend that maybe we will, the little hints that we could do. And suddenly the virus is mutating. Oh, crikey, better batten down because the storm is coming. Right. And then the next thing you know, midnight tonight, that's it, finished. Restaurants shut.
Yeah, and in other situations when these decisions have been made, the restaurant businesses and the pubs have said, okay, you've given us a few days, we'll deal with it. Today they're saying, we've got all this stock, because we thought we were going to be open for Christmas, and we've got all this stuff that we can't now sell, which is perishable.
It is ridiculous. And, I get my turkey from Smithfield every year on Christmas Eve. I'm just hoping I can still go.
Right.
order one, and I'd better go down the supermarket and get them or put it in the freezer in case. Yes, but I think it is just so sad for people that have adapted so well, and that's the one thing that I'm full of praise. Everywhere I go, people have done tremendous lengths to adapt to some of the very silly rules that are out there, including who can and can't dine with each other in a restaurant. I mean, made to sit with 5 work colleagues. I went for a snack, a substantial snack, you must understand, but no alcohol at lunchtime. And we had to sit on separate tables. There were 5 of us sitting on separate tables, shouting at each other across the restaurant with a scampi and chips. I mean, it was just the most ridiculous scene, and that's the trouble with this. It's getting the evidence, and there's very little evidence at stake here.
Right.
And then,
and also, the only thing you can conclude, presumably, is that the Tier 2 situation, which London was in until we change it tonight, somehow didn't work.
That's right. Does Tier 3 really bring any benefits over Tier 2? I mean, the aim is to reduce social contact. That's the ultimate aim. So everything, all the little things, the closure time at 11 o'clock, in Wales, the most ridiculous thing where you have the pubs are allowed to open till 6, but they're not allowed to serve any booze. I mean, this is just wonderful. Imagine a little Welsh villager comes into his pub wanting his pint of bitter, and absolutely no chance. He gets a pint of lemonade instead. He's not going to go back the next day. I think that's the problem. It's understanding how people behave. It seems that these politicians don't have a clue, and it's a bit worrying that this should be the case at this late stage in the pandemic.
Well, that's the thing. I mean, one of the things that I've been saying as well about all of these politicians is that they are not just governed by scientists. I mean, I discovered over the weekend that Sage is packed full of what is remarkably sort of referred to as social psychologists, people who are behavioural scientists. I mean, they're not like you. They're not medical people. They don't have a clue about what medical things are good and bad. But what they are good at is making up ridiculous theories about how people will behave depending on what you tell them.
Social psychology is a fascinating business. I never understand it because it doesn't have much evidence base all the time. You know, if you have cancer and you give a drug and the cancer shrinks, you've got an X-ray, you've got a marker in the blood, perhaps you can see what's happening. Right. But in psychology, there's nothing to follow. And so people get theories, and that's what's happened. You're right. Sage is dominated by well-meaning and experienced psychologists that want to change. It's a sort of psychops. Can we change the mindset of the British people?
Right.
And I think
well, before you go any further, Carol, excuse me, nobody gave them that right. Nobody asked them to change the mindset of the British people. That's not what we voted for. That's not what we had elections for. We do not wish to be bullied and cajoled into thinking in a particular way just because a bunch of bozos who are paid by the public purse think we should.
That's an extreme version, Mike, but I sympathise with it. I really do. I mean, there's no doubt that they're sitting from a position of comfort, job, security, pension, all these things. No one's going to fire them tomorrow because the restaurant owner decides he's going to call it in and say, I'm packing up for the rest of the year. In fact, I'm packing up forever because this is never going to pay. I'm never going to pay the debt on the rent. I'm just locking up and throwing the keys, leaving the keys behind. That's what's going to happen to a lot of places. There's no alternative when you do this. And, you know, the vaccine program, it'll roll out much slower than we think it will for a variety of reasons. And as we move forward, businesses will reconstruct themselves, and that's what will happen. But a lot of people will lose out, and a lot of effort will have been wasted.
Yes, but also the overriding kind of principle of all of this, right, is that none of it actually works. Because if any of it did work, we would be out of it by now. But all of these lockdowns, all of these kind of measures, all of these closing of hospitality businesses has not actually stemmed the flow of the disease. In fact, they're now telling us, oh, it's now mutated. There's a new disease. So actually everything we did before was a complete waste of time.
There's no doubt that the evidence that going between the tiers, it does show some minimal change, but the most important thing is just dampening down social contact in any way possible. And the only way to do that is, if you really want to do it properly, you've got to do it with military style. And that's what other countries have. Asia did it. Singapore, fantastic military style shutdown. Korea, Vietnam, these countries, they know how to do it. Even in the Gulf, which again, a crackdown on people really forced into isolation. Here, we've dabbled in it. And, going from tier 2 to tier 3 doesn't really make a big difference as far as I can see, but it causes a lot of unpleasantness and a lot of suffering.
Yeah, because really the only difference between 2 and 3 at this moment in time is hospitality, isn't it? Because everybody else is going to keep the gyms open. They're presumably going to keep the hairdressers open. They're going to keep everything open that they have done in other parts of the country where tier 3 is involved. So the only reason to do it is to stop people going out and having a good time before Christmas. And it just doesn't make any sense to me at all. There is no evidence still, I don't think, Carol, that it spreads in bars and restaurants anyway.
No, there's very little evidence. Very little evidence it spreads in planes. And, that's the place I'd be most worried. But there's no evidence base that, sure, if you sit next to someone that's hot with COVID, it's more likely you'll pick it up. But the evidence that airplane travel and overseas travel actually is increasing the risk of you getting COVID is pretty small, which is surprising perhaps, because there you are confined in a metal tube basically for several hours, and yet no evidence of it. So what's the difference when you go to a restaurant in a nice part of London?
No, exactly right. Now let's talk about the vaccine, because there's a few problems that I'd like to address with you. I spoke to some friends of mine over the weekend who told me that they work in the NHS and they weren't normally going to get the vaccine. However, they ended up getting it because people who were supposed to be given it missed their appointments, didn't show up, and so they started giving it out to more or less anyone. I spoke to Dr. Lawrence Gurlis yesterday, who said if you were at Guy's Hospital last week, you could have got a free vaccine, basically, because they had so many of them and not enough people to give them to. Similarly, we're told that the doctors, this is another Matt Hancock, shall we say, I don't know if I want to say he was being economical with the truth, but he was boasting about the fact that GPs are now giving out the vaccine, where clearly many of them are not able to do so because of either red tape or because they don't have it.
Yeah. So this sort of thing it bedevils our system, and it's because there's so many. It's a divided system. You've got the primary care system, the GPs. You've got secondary care, that's the hospitals, and then the agencies that deal with things. The problem is, they've had 6 months to make up a list of the category 1 people over 70, people frontline in the NHS, make a list and just get it done. It's not difficult, you think. You can bring in the army for distribution. Yeah. You don't need a doctor to administer the vaccine, or you don't need a nurse even. You need healthcare assistant, someone that's trained for a day to give injections can do it. That's the easy bit. They do need to be in a medical environment because people can go wrong. They can have 2 people already have had an anaphylactic shock type. So you've got to have doctors around and nurses around and so on. So that's all you need. And people need to have a place to sit, maybe have a cup of coffee for half an hour so they don't rush out. So after half an hour, it's unlikely they'll have any serious effects. So that's the plan. But the trouble is the logistics behind that. There was a lot of argy-bargy about who's paying for it. And GPs are very good at negotiating payment schemes, much better than hospitals. And it was going to be £12.50 when it first was mooted. And I'm sure £12.50 per patient. They would do the shot, basically, and supervise the administration of the shot. I think part of the problem is getting the lists together, getting the patients in the place. And then the thing that's annoyed my colleagues is that where's the vaccine? Yeah. So everything's organized, the chairs are there, the church hall is rented. Let's get the vaccine. And nothing arrives in a box. Yeah. And then you're stuck. And you have to send people home. The vaccine comes the next day. The patients have gone. Let's give it to people that want it, that are out there now, staff and so on. And that's what's happened.
Well, we've got one GP in Southport cancelling 128 appointments, right? We've got another one in Kent cancelling 80 vaccination appointments because they simply don't have the vaccine. Also, if they get the vaccine, they have to be able to administer it within a very relatively short period of time, because if it's out in the open and it's too hot, it doesn't work.
Yeah, it's one of the downsides of the Pfizer vaccine, -80, and it can only last a few hours outside that environment. The Oxford one, if it gets a license, which I assume it will next week, That's better. That could put in a normal fridge, and that's much better for developing countries. It's all a matter of logistics, Mike, and we're not great at logistics. I think if the one thing you look back on the last 6 months, the thing that's been dreadful is the government's handling of logistics. They have a minister, and he seemed competent. I mean, I heard him speak. He sounds competent, and it's not rocket science immunising a population.
It's really not. But they don't seem to be very good at very much, I'm afraid. I mean, it's very difficult. It would be easier to pin the tail on the donkey than to find something the government's actually any use at, you know? They seem to be completely and utterly useless at almost everything. But basically, here we are in this place where we knew we were going to be, and yet we are no better off. And it seems to me that they are being led by events rather than judging the events and leading by example.
And not only that, there will be problems with the vaccine. There always are problems. I mean, they don't come immediately. There'll be some side effects we haven't thought of. It'll be scares. And are you confident that these are the guys that can lead you out of it? I'm not so sure.
No.
The only thing they seem to be able to organise is when it comes to voting time, that's impeccably organised for some reason. You know how the people chase you up.
They're very good at that.
But when it comes to this, the logistics are not so cool.
No, you're absolutely right. Professor Carol Sikora, thank you very much indeed, as ever, for cutting us some slack and actually telling us the truth, which we don't get from the government very often. 0344 499 1000. He's the former head of the WHO Cancer Programme, Dean of Medicine at the University of Buckingham. I want to hear from all of you out there, because if you know someone who's supposed to be getting a vaccine today from the GP, I need to know whether it's happening, because it seems to me that it is not happening in the way that it should. And quite simply, that is all down to the complete and utter incompetence of this government. 0344 499 1000 is the number. Don't forget, we are live streaming on YouTube, on Facebook and on Twitter. This is Talk Radio.
Talk Radio.
Welcome back to the Independent Republic of Mike Graham, right here on Talk Radio. Pete says this: I went to a bar at lunchtime yesterday which was virtually empty. I had a few beers by myself and my substantial meal was 2 rounds of toast. #madness. Well, it has been madness, and the idea that somehow, because we have seen an uptick in the number of infections, largely due, of course, to school children actually passing it to each other in parts of London, which are not anywhere near the centre, we have now shut down the entire capital city of this country, which to me is complete and utter madness. You cannot tell me that this is going to make any difference whatsoever to the spread of coronavirus. And the idea that Matt Hancock has now come out with this nonsense that, there's a new strain which we weren't expecting, is absolutely misleading, I would say, verging on absolutely and utterly disgraceful, to try and make out that that's the reason why somehow we have to shut all the restaurants. Let's talk to James Kiri, director of Il Portico, which of course is London's oldest family-run restaurant over in Kensington High Street. James, very good morning to you.
Good morning, Mike. Nice to speak to you again.
Yeah, good to talk to you, James. I felt for you yesterday. I was actually in a restaurant in Borough Market when the news came through that they were going to go into Tier 3. Yeah. And I just thought to myself, what is the point? And the people that were all around me were all saying the same thing. You know, how on earth is this going to help anyone? All it's going to do is make your life miserable, make the people who work for you lives miserable, and just basically, you're being prevented from actually operating.
We are. But unfortunately, I mean, we're well used to being the scapegoat of this pandemic this year. So, I mean, honestly, it's nothing new. We know that hospitality industry is responsible for an incredibly low percentage of infections. We know that from the track and trace system.
Yeah.
It's somewhere between 1.5% and 2% of all infections.
Right.
So, I mean, it's really, the science does not back up shutting down restaurants and bars. It's just that simple.
No, but you're a very even-handed person, James, and I'm amazed at how even-handed you are. Because if I was you, I would literally be spitting mad. I'd be turning up at Downing Street with a Land Rover and a cavalcade of people trying to burst through the doors to say, "Stop doing this to me."
It would not surprise me if I switched on the news and saw you doing that, Mike, to be quite honest with you.
But you know what I mean? I mean, you're incredibly calm about it, considering that you're now going to... I mean, you don't even know when you can open now, do you?
No, I don't. I think they're going to review it on the 23rd, which is what they said. But, I mean, that did come out of the mouth of Matt Hancock, so it does need to be taken with a
Well, exactly. Yeah. I mean,
the question is do any of us have any confidence left in this administration? It's just that simple. And if the answer is a resounding no, then we just need a good broom, just come out and sweep the room clean, and we just need to get in there and start next year completely afresh. And we need a great reset. We need to look at the facts, and we need to have a common sense approach of what's working and what isn't working, and enough of this political posturing, because we know that shutting down hospitality is good. Is good political move for the government, because voters, it's popular with voters, not popular with me and you and our listeners, but the majority of voters are quite happy with that move, so long as the kids stay at school. But we know that that's not the reality. That's not going to.
Yeah, but guess what?
Infections.
Guess where the spread is the worst? In school. It's nothing to do. It's not happening in El Portico. It's happening in the school down the road.
I know, and I totally agree with you. And the other problem is that whenever the schools break up, for example, all the private schools in central London, whenever they break up, there's always a surge in infections. Because if you're a family of 5 and you want to go back to France or Italy or Spain or Switzerland for Christmas holidays once the schools finish, the first thing you're going to do is get all your family tested so you can get on an aeroplane.
Right.
And the chances are that one of you might be asymptomatic, normally a youngest kid with plenty of T cells, so it's not an issue. So the infections are going to rise. But that doesn't mean that it's any more dangerous than it was 6 months ago.
No. But that's the point. I mean, you put out a tweet yesterday saying you've got 24 hours to shift 7,000 quid's worth of stock.
That's right.
Now, I'm sure there are other restaurateurs who are even in a worse position than you are, but what are you going to do about that?
Well, get creative. I mean, we got 2 restaurants. We bought a load of stock in for Christmas this week. We expected a really bonanza week. We had reservations through the roof because everybody was expecting the shutdown to come on the 19th. So lunch and dinner, back-to-back bookings for the whole week. So we thought, lovely, ordering a load of stock. And then that Wally in that bloody health department gives us 24 hours notice. And you think, well, for crying out loud. I mean, we've had more ins and outs on these tiers than the bleeding hokey-cokey.
I know. I mean, this is the thing. I mean, have you even considered, and you're too nice, I'm sure, for this, but, you should be suing these people.
Well, I don't think that's going to get me very far, to be honest with you, Mike. Look, at the end of the day...
I can put you in touch with some decent lawyers who will do it on a no-win, no-fee basis.
Do you know what? I'm sure that there's going to be a lot of lawyers, a lot of people with no-win, no-fees coming out next year, and a lot of business is going to be rightly angry, and a lot of business is going to look for some sort of compensation. And we know that insurance companies aren't stepping up to the plate. We know that they've dodged and welched out of paying everybody. They've certainly dodged and welched out on paying mine.
Right.
And, they're based all out in Bermuda anyway, so they can just walk away from this and say, sue us in Bermuda. What are you going to do?
But this is the thing. I mean, all these people, right, who go, oh, don't worry, you'll be able to just pick up your business. But literally, I mean, I don't want to labour the point, but you don't actually know. I mean, if I said to you, when can I book a table to come and have dinner with you, you can't tell me.
I can't tell you, Mike. Exactly right. I can't tell you until the oracle of the orifice, I should say, at Delphi, there at the health department, lets us know where we can do it. And it really is. It's frustrating from a perspective that the government has done a lot of things right, especially with the economy in trying to stop the hemorrhaging of redundancies. It's doing its best, but it's just offset by a completely catastrophic communication strategy, which leaves businesses 24 hours notice, to sort themselves out, and everybody just goes into a tailspin of a panic. You've got basically, I've got today's lunch and today's dinner. I've got to get to as much stock as I can. I've got to try and switch to some sort of delivery business if possible. And then, and then I've got Christmas. But shaking my fist at the sky is not going to, frankly, pay my mortgage. Is not going to put food on my table for my 3 children. What is going to do that is a policy of strategizing, organising, and planning well for the future. And, come what may, it doesn't matter what the government says. In the restaurant business, for any small business, painters and decorators, electricians, plumbers, restaurants, all of your loyal listeners will all be in the same boat as me. We're well used to the government being nothing but an absolute hindrance to our lives. We're well used to the government just putting up obstacles to us earning a living and supporting our family. And do you know what? Par for the course. So they've done it again. Big deal. We'll keep on going. We'll keep on fighting. We'll keep on working. And it'll be us. It'll be us. All the working people who fundamentally get this country back together next year, and it's not going to be those idiots at Whitehall. Well,
let's hope that's true. But the problem is, James, is that, people like yourself, who are the lifeblood, as I call it, of many, many industries in this country, because not only are you employing people, and not only are you buying things, not only are you paying tax, but you're also allowing people to come to your establishment and actually behave like a human being. Actually, I was in your place last week, and it was great. It was noisy. It was busy. You were having people socially distanced. You were people on proper tables, one far away from the other, and you had screens and all of that. I just don't understand what the government has got against hospitality. It's almost as though they've got some kind of death wish against you.
Yeah, I think a friend of mine, journalist, said on Twitter he wondered if Boris Johnson was bitten by a restaurant as a child.
Yeah.
I think it was a very good way of looking at it, yeah.
Because there doesn't seem to be there's no logic to it. There's no, as you say, there's no evidence to suggest that restaurants and bars are spreading the disease. There's nothing to say that you shouldn't be able to continue to remain open and make the money that you can make and pay the taxes that you pay and employ the people that you employ. It's almost like they have some kind of a grudge against you.
Yeah, which is crazy when you think that we know what a huge contributor we are to the nation's pension pot.
Right.
I mean, we employ, I think, 650,000 people in this country. Dan Watson was saying we're employed in the hospitality industry. I mean, that's an awful lot of people to leave behind.
Yeah.
And also, a lot of these people, restaurants are a very labour-intensive organisation. You've got a lot of people working behind the bar, on the floor, in the kitchen, in the back office. We employ an awful lot of people. As a small company, you employ maybe 10, 20, 30 people.
Yeah.
It's not unheard of. And, and that adds up to an awful lot in the coffers of the Treasury. And the other thing that the Treasury would be minded to remember is that if we don't employ these people, who are going to employ them?
Right.
Because a lot of guys who work in this business, myself included, are sort of square pegs in round holes. We don't really fit in an office structure. We can't sort of retrain in cyber or whatever it is that the Department of Trade want to.
Oh, yeah, that was great, wasn't it? Maybe your next job will be in cyber. Oh, yeah? Maybe my next job will be murdering somebody because I'm so fed up with what you've done. I mean, here's the thing. In terms of yesterday, right, I was in a restaurant called Roast, which is here in Borough Market. Everyone in there is a European, right? The waiters, the people at the front desk, the people behind the bar, they're all obviously here from other countries in Europe. Now, I said to them yesterday, I said, I'm really sorry that when I walk out of here today, I may not see you now for another 2 months.
I know. It's crazy, isn't it? But, onwards and upwards, Mike. I mean, we'll have to wait and see. We don't even know. They said that whether they're going to extend the VAT reduction.
Right.
They said that so for now, for the final quarter of the year, we pay 5% VAT. Which is great. Obviously, that's a big help to us. But if they're going to jack it back up to 20% again in January, well, a lot of places will just look at that and just say, well, do you know what? Why should I give away 20% to the organisation that has done the most amount of harm to my business this year? Quite frankly, I'll jack it in. And not only when the restaurant closes down, it's not just that the punters don't have anywhere to eat. It's that you can have 25 people out on the dole.
It's absolutely ridiculous.
Everyone's going to close down.
I've just had a tweet here from a friend of mine, Pooch, who used to put on some shows for us, right? He says, I've just had 5 Christmas gigs cancelled. He's a promoter, right? Last year's turnover over 400,000 quid. This year, 7.5 thousand. That's 400,000 employed sound engineers, lighting engineers, musicians, venue fees, caterers, and more. These people have had no work all year. It's absolute madness.
Yeah.
That's where we are. It
is crazy, Mike. It absolutely is crazy. And, mathematics is not an opinion. You look at the cold, hard facts of redundancies that came out today, and that's the reality of where we are. And that is the absolute reality. And that's not just the unemployment. You've also got to look at the other tolls of people who have mental health issues.
Yeah.
You have people who rely on community assets like pubs and restaurants in order to go out and socialise. You have people who may be a little bit more fragile, who need that support of their community around them, and if they don't have that support, they will withdraw, and it's very dangerous indeed. And we need to get ourselves back up and running. We need a community. We need a sense of us, a sense of the we, and the gathering points of all that traditionally in this country has always been local restaurants and always been local village pubs, and that is the absolute backbone of this, not just of this economy, but of this nation's mental health. We need to go out there, we need to mingle, we need to mix, we need to see our friends as quickly and as safely as possible. The government has got to pull their bloody finger out, get these vaccines out there ASAP so that we can get trading. It is so imperative. I can't stress how important it is for people now, because otherwise, if this lockdown continues for much longer, you're going to see a big, big case in mental health issues, and nobody wants to see that.
It's awful, absolutely awful. James, listen, my heart goes out to you. Thank you so much for talking to us. I'll see you soon, hopefully, at some point or other, when you're able to open the restaurant again, which probably won't be until the new year. But if that's possible, I will be there, and I'll be there supporting it, because it's not about me having a great time and going out for dinner. It's about supporting the industry, which is one of the backbones of this country. The idea that somehow the government, full of people who are on the public payroll, paid by us, by the way, people who are supposedly representing us, are shutting our cities down, shutting our restaurants down, shutting our bars down. I've had enough of it. I'm sick to death of these people. And if Matt Hancock thinks that he can go around ordering me what to do, when to do it, how to do it, who to do it with. He could get stuffed, and I'd quite like to fire him. That's coming straight from the horse's mouth here at the Independent Republican Mike Graham. This is Talk Radio.
Online, on DAB, and on the Talk Radio app. Talk Radio. Talk Radio.
Now, I had to put up with a bit of this last night, right? Shelley is one who has done something similar. She's tweeted me and said, "You're only going on about Tier 3 now. London has been put in it. Nothing was said about all the businesses going under in the rest of the country. We've been in it for weeks." Well, I think you'll find, Shelley, that I spoke to a hotelier from Kenilworth, which, as far as I know, is not in London. It's up in Birmingham region, who talks about how terrible his business was going because he wasn't able to open it and his two hotels were struggling. We spoke to a pub owner in Dundee the other day who told us about how he was losing £13,000 a month. We have been railing on about the problems in Scotland, in Manchester, in Leeds, in Newcastle, in Durham, in all sorts of parts of the country where people are being victimised by this government and its policy. And the idea that lockdown is not doing any harm at all and is doing only good. And quite frankly, it's not doing any good at all either, because if it was doing any good, then surely this disease would have been stopped. Let's go to the phones and get some common sense. 0344 499 1000 is the number. John is in Liverpool. Hi, John.
Hello, Mike.
How you doing, John?
All right, not too bad. Well, I've got Parkinson's. I'm 73.
Right.
So it's a bit difficult to focus on what you want to say. But I was listening to you earlier on with Carol Sikora.
Yes.
Is that the right pronunciation?
It is. Yes.
Yeah. But Mike, I listen to you a lot now, and we discovered Talk Radio about 6 months ago. I have spoken to you once about Anderson and A. Presto. He's locked up.
Well, we can't talk about him now because he's under charge.
No, exactly. But that wasn't what I wanted to say. What I wanted to say was, after the time I've been listening to you, you and Julia, you seem to get a lot of people on who agree with your line of thought. And Carol Sikora always seems to agree with everything you say. Now,
that's because I talk so much sense, John.
Well, yeah, I must admit, I do agree with a lot of what he says, but when we don't seem to be hearing the other side of the argument. Now, most people who you get on seem to agree with your line of thought, which most of the time I do. But unless you hear both sides of the argument, I think you need to get more people on who advocate this line of approach to lockdown.
Listen, John, I'm always asking for people to tell me why lockdown is a good idea. We've always asked for government spokespeople to come on, but they don't want to. You know why they don't want to? Because I would absolutely rip them to shreds and I would destroy their argument in 5 minutes. And I don't think that's terribly good radio. But they're very welcome to come on if they want to. We ask them continually, but most often they say no.
Well, okay. Perhaps you want to go Chris Whitty.
Yes.
There must be people out there in his line of expertise who agree with him, and surely you can find somebody.
Well, they're all in the government, mate.
Well, you can't find anybody who agrees with their.
Well, who do you suggest, John? I don't know anyone who agrees with Chris Whitty in the real world, because Chris Whitty, to me, is an absolute and utter weirdo who thinks that you shouldn't go outside in case you get hit by a car.
Well, I didn't know that, but surely there's somebody out there who can put forward that side of the argument. Well,
there is, Chris Whitty is one person. Matt Hancock is another person. You could also get any other members of the government who agree with what is going on and what is being ordered by Imperial College. Neil Ferguson, the bozo who thought it was a great idea to tell everybody else to stay in their houses while he got his leg over with a German woman who was married to somebody else. You know, these are all the people who agree with Chris Whitty, but they don't come on my show.
No, but again, you keep saying that this government is incompetent. But surely the only alternative is the other bunch of left-wing wally brains. You don't.
No, I'm not saying that, John. I'm not saying I want the Labour Party in charge. I'm sure Keir Starmer would be even worse. But I am not going to defend what Boris Johnson does simply because I'd prefer him to be in rather than Labour. If I think he's doing something wrong, I'm going to tell him he's doing something wrong.
Yeah. I would just like to see we're locked down because I'm considered vulnerable because of what I've got.
You're in tier 2 now, right?
We're in tier 2. Yeah.
So you're better off than I am.
Yeah. But
I mean, can you tell me, John? Listen. Let me get your opinion. Can you tell me why lockdowns are a good idea? Because they don't seem to work.
Well, they don't exactly, and I can't see, given the measures that have been put in place in pubs, because my brother-in-law lives on his own. He's 69, and his whole life revolves around. He's still working at 69 in engineering, and his whole life revolves around finishing work and going for a couple of drinks.
Yeah, exactly. So what is the point of preventing that from going on? It's absolute madness to me.
Well, but what I'd like to hear is somebody who can knock that argument down, because I think that pubs have made a huge effort, and the only downside I can think of is when later on, when people start to have too much drink, they do let their guard down. And a prime example is over the weekend, it started to get late, big argument broke out, and there's a wacky great brawl in the pub.
Right.
Chairs going everywhere, chaos, police coming.
Well, listen, I can assure you, John, right, that I went for lunch yesterday. I had a Scotch egg to start. I had some roast beef and Yorkshire pudding and a couple of glasses of wine, and I did not end up fighting anyone. So, you know, that's an extreme case, and it doesn't have to happen that way. But listen, I appreciate your call. I appreciate your message as well. Listen, I would love to get people on for the government to tell me why lockdown is a good idea, but they won't come on. And they know why they won't come on. They won't come on because I would absolutely destroy their argument in about 2 nanoseconds. That's the story. This is Talk Radio.
Talk Radio.
Good morning and welcome back to the Independent Republican Mike Graham right here on Talk Radio. The week continues to become more and more ridiculous. Yesterday afternoon, the government announced that London would move into Tier 3 tonight, leaving thousands of restaurants and pubs bereft. We spoke to James Kiri in the last hour, who said basically he's got £7,000 worth of stock. He's only got 1 day in which to get rid of it, i.e. lunchtime today and or dinner tonight. So if you haven't made any plans, I would get yourself over there immediately. Toot sweet, as we used to say in Spain, because in the end, only restaurateurs who actually are trying to do the right thing are the ones who should be supported. We're hearing this morning that basically the leader of Greenwich Council has had to make a reverse ferret on the closing of schools because it turns out that Gavin Williamson, the Education Secretary, has said you can't do it. They wanted to shut all the schools because that's what Sadiq Khan told them to do. I'm delighted to say that Sadiq Khan has not got his way, and he'll probably put a few more cycle lanes into Greenwich just to punish everybody when they're trying to take their kids to school. But, he's already doing it. What do you mean? Oh, really? Oh, of course he is. Yeah, absolutely right. Coming up also, for those of you who are big fans of Nicola Sturgeon, it's just been revealed that drug deaths in Scotland have reached the worst level on record, rising by 6% in a year. Right? That means figures from the National Records of Scotland show that in 2019, 1,264 people died from drugs misuse, which is 77 more than in 2018. Now, you might say, why don't they do away with drugs? the way they're trying to do away with the coronavirus. What's that you say? They can't do it. Really? Because why? They're just not really very competent, are they? 0344 499 1000 is the number. We're going to talk to Professor Hugh Pennington coming up in this hour, Emeritus Professor of Bacteriology at Aberdeen University. We might ask him about the drug problem in Scotland, but we will also ask him about this supposedly new strain of coronavirus, which Matt Hancock has laid upon us all to convince us that that's why he has to lock everybody up and tell everybody not to go out. What an absolute shower of shambles this government has turned out to be. 0344 499 1000 is the number. You're listening to me, Mike Graham, right here on the fastest growing radio station on the planet. It is, of course, Talk Radio.
Mid-morning with Mike Graham. Talk Radio.
Now, John from Liverpool made a very good point just before the news in which he said, why don't you get some people on who can actually defend why the lockdown is a good idea? Well, I'll tell you why that is, John, and I'll tell you why that is to everybody else. It's quite difficult finding anyone sensible to defend the lockdown situation. Look at what they've been doing in Wales. Look at what they've been doing in Leicester. They've been having lockdowns pretty much since about April. And guess what? Nothing has changed. Nothing has made any difference whatsoever. And this current lockdown, which we're about to go into tonight, which is Tier 3, which is basically Tier 2 without restaurants and pubs, means that you will find people going to each other's houses. You will find people, socialising. They won't stop socialising. It's Christmas after all. And it makes absolutely not one iota of difference to the spread of coronavirus. Let's find out from Professor Hugh Pennington whether he agrees with me. Hugh, a very good morning to you. Welcome.
Hi there, Mike.
Now, you're a very sensible man, Hugh. Can you tell me what the benefit of a lockdown is? Because I'm struggling right now to know why Matt Hancock has decided, with the aid of this rather bizarre piece of information that the disease has apparently mutated, that he wants to now tell us all we can't go out.
Well, I mean, the lockdowns suppress the virus a bit. They don't get rid of it, which, of course, is the ultimate aim, but they suppress the amount of virus that's being transmitted, because we know that there have been outbreaks in pubs, where people get very happy and close together and all that kind of stuff. Now, of course, a well-run pub where people are socially distanced and all that kind of stuff, and there's even more in a restaurant where, generally speaking, people are not singing and shouting, although it's inside, which is higher risk than outside, it's relatively low risk. But, of course, what the government has to do to show that it is doing something is to do something that is effective in the sense of it affects how we behave.
Yes, but you say, Hugh, that there's evidence that it gets spread in pubs. Actually, that's not true. There is no evidence that it gets spread in pubs. I mean, something between 1% and 3%. Is what the likelihood is apparently of the disease being spread in a hospitality setting, isn't it?
Well, up to a point, we had a big outbreak, a pub outbreak in Aberdeen, and it was people after a football match, and it was the winning side, and they were having a big celebration.
Well, that is quite unusual in Aberdeen, isn't it, for them to win?
I know. And then there was a big one in New Zealand on St. Patrick's Day where people were told to get them, we're invited to become and get themselves shamrocked. That's the sort of event where we know that when there's a lot of noise and shouting and singing and, all that kind of stuff, which of course is helped by people drinking, the virus likes that. It gets around because people are breathing heavily. They're breathing a lot more virus out. People are breathing it in because they're also breathing heavily and so on. But if you control that, you will reduce the risk very substantially. And we do know at the end of the day, and we've known since January, that the best place to catch the virus is at home.
Yes.
That the domestic environment is still the best place to catch the virus, particularly if you've got a sort of extended family, where there are elderly folk in the house as well as young kids. Because we know that a lot of the virus that's about at the moment is affecting people in their late teens, early 20s and 30s. That's where the bulk of the virus is. But of course, those people are basically spreading the virus to elderly people.
Yes.
And so on. That's one of the issues that we have to cope with.
But you may want to answer that while I talk over it. But the bottom line for me, Hugh, is that yes, it's true that the disease spreads inside the home. However, we are being told constantly by the government that the home is where they want us to stay. They don't want us to go out. They don't want us to travel. They don't want us to go anywhere unless it's absolutely essential. They don't want us to go to work. They want us to work from home. And yet, that surely is spreading the disease more, isn't it?
Well, up to a point. I mean, if you travel, you'll pick the virus up. We know from doing all this gene sequencing and looking at the mutations in the virus that a lot of the virus that's responsible for this second wave has been imported, quite a bit of it from Europe and from other parts of the UK. So travel is obviously been very important in moving the virus about. Well, that's actually common sense. You know, if you go to a country where the virus is very common, you still have a chance of picking it up. And of course, the other thing that this virus has, which makes it very difficult to track, is that many of the cases don't have any symptoms. And so because you feel fine doesn't mean to say you're not likely to have the virus and be able to spread it. And
well, how do we know that, though? Because let's face it, the only reason we think people have it without having any symptoms is that they may test positive for it without having any symptoms. Now, is it not entirely possible that they're testing positive for it, not because they've got it showing no symptoms, but actually they haven't got it, and the positive test is wrong?
No, I think the test is a very reliable test. The RT-PCR test, some of these more rapid tests are, a bit dodgy. And, well, I mean, they're better than nothing. But you have to be very carefully interpreting the results. A negative doesn't mean you haven't got the virus. And sometimes there are false positives. But the RT-PCR test, which is the standard test we've been using, is a very accurate test. And if it's done properly, the results are very reliable. And we do know, though, of course, that some people go on testing positive for a while after they've had the virus.
Yeah.
And that's because there are bits of the RNA of the virus hanging about. The virus is not infectious in those people. But for generally speaking, if you have a high positive test, you've got infectious virus and you're likely to spread it. Now, the other side of that argument is that we know that many people who have the virus don't actually spread it. That many of the sort of gene variants that we find don't last very long. The virus fizzles out. Now, that's a property of this virus, that it specializes in causing these super spreader events where one person can infect a whole heap of other folk.
But isn't the problem partly, though, Hugh, that we don't really understand how it spreads, and we don't really understand how it affects people, because everybody that I've known over the course of, say, the last 9 months who have had coronavirus and who have got it one way or another, have had it treat them in a completely different way. You know, I've had some youngish people who have said, it was really debilitating and they were quite ill for a few days, but they're still suffering as a result. They can't do maybe the things they used to do. They feel tired all the time. I've also known people who had it and were, say, in bed for a week and are now absolutely fine. I've also known people who had it who never really felt the symptoms at all, but they self-isolated for 14 days. I mean, I don't think we know really much about it at all. And so I find it very frustrating that this government continues to put these lockdown measures in, which are really hurting people's financial capabilities and hurting their businesses. And yet we don't really know why we're doing it.
Well, yes. I mean, they're forced into doing lockdowns because they can do nothing else. They don't have a good contact tracing system. That's one of the big problems that we have in the UK and many European countries. Yeah. We can test people, we can find they're positive, then we ask them to go and self-isolate, but we haven't given them the incentive to do that. No. So we know that from surveys that many people who are asked to self-isolate say, yep, and then they don't. And they don't because it's so inconvenient, they lose money, etc., etc. And the solution to that problem, well, there are two solutions to that problem. One is to give them better financial support, which would help a deal to make sure that people, when they're asked to self-isolate, don't get penalized as a consequence. Okay, they have to stay at home 10 days or whatever it is, the figure changes.
But that's the other, that's the other thing, isn't it?
They're not going to do it. Right. And then the other thing is we could do what the Chinese did and what they did in New Zealand and Australia is basically put people either in these what the Chinese call the Fang Gang hospitals, which kind of giant Nightingale hospitals where you put in there for a couple of weeks, or you do in Australia and New Zealand, you put you into a hotel and have an armed guard at the door to stop you walking out. But we haven't done that. We did that right at the beginning, if you remember. We had a couple of places, and then we gave up doing that. We gave up testing, and we gave up contact tracing. Bad mistakes.
But yeah, I mean, we can look back and say we should have done this, we should have done that. I mean, I was one of the first people at the beginning to say, should we not be stopping people from flying in from China and Iran and northern Italy, where it seems to be the hotspots of the disease are? And I was told by medical people back then, oh, there's no point in doing that because in the end, you can't really stop the spread of the disease. It's already here. And I'm thinking, well, I'm pretty sure you can probably improve things if you don't let people fly in. But the other thing is, Hugh, you know, we've suddenly gone, as you quite rightly said, from 14 days quarantine to 10 days quarantine. You know, has the virus changed? How is that changed? Why have we suddenly gone down to 10 days? And what's the difference?
Well, they've done a risk assessment. They say, well, 10 days, you will still have a few folk who are still shedding virus, but the numbers are small, so we get away with it. And I think it's also a response to what I was saying about that asking people to self-isolate has proved very difficult because most don't. And really, if you make it easier for them to self-isolate by reducing the time they've got to do it, more people will do it.
But what I'm saying, my point though, Hugh, is that in terms of public health and public safety, it's very arbitrary, isn't it? Because if it was actually 14 days that you needed to self-isolate for, then you wouldn't change it. Now they're saying it's 10. Is that more dangerous, less dangerous, or does it not matter?
Slightly more dangerous.
Really?
Slightly more. But
so
of course,
the government is now endangering the public by reducing the amount of time you're supposed to be quarantining?
A wee bit. But the problem is, of course, you get this mixed message. You know, last week it was this, and then this week it's this,
right.
Something different.
That's what I mean.
Clearly, there has to be a consistent and absolutely trustworthy message going out to the public to persuade them that what's being recommended and what's being not just recommended, what's legal or illegal if you don't.
Yeah. But it's completely ridiculous, right? Because, for example, if you're a person of high net worth and you happen to be a business person, you happen to decide to go to Tenerife to go and do some business and you come back, because you are a businessman or woman, you're allowed to come back into town. If I go to, as a journalist, to go and see somebody in America and I do a show in America, I can come back and not quarantine because I'm a journalist. But it doesn't make me any different from you or anybody else.
No, I found that a bit puzzling because it's not based on science. You know, it's based on economics. And of course, the two are clashing all the time in this particular business. That there's the people who want to keep the economy going on the one hand, and the people who want to stop the virus on the other. And clearly, there's a battle between them. And you know, it's sort of the front moves, you know, this way.
Yes.
And then
listen, and I'm one of those in favour of letting the economy go. And let the economy sort itself out and deal with those people who are obviously in some imminent danger, who might be vulnerable, who shouldn't be exposed to the disease, but don't punish the entire nation. And that worries me. You know, when Matt Hancock comes out yesterday and in order to kind of justify his moving London into tier 3, he starts banging on about some mutation of the virus. Quite frankly, I don't believe him.
Well, I mean, there has been a mutation, but there have been hundreds of mutations. We've been doing gene sequencing of this virus in the UK. Really, that's one of the good things that's been done on a grand scale. And we've found hundreds of different variants of the virus. And some of them, many of them actually die out, but a few of them get going and get common. And what really helps them are these super spreader events where people get together and there's some great massive outbreak. And of course, we've seen those sort of things in meat plants where there have been enormous outbreaks, you know, with hundreds of cases.
Yeah.
And then there were, of course, the students coming back. That was a bad mistake because we knew that students, the virus gets around very easily in student hall as residents. Yeah. It had already done that a month before in the US.
But guess what, Hugh? Students have all been told to go back to their homes, right, in the last week or so. And suddenly we've got another spike. And you go, really? Well, let's stroke our chins and wonder how that could have happened. And yet, instead of telling students just to stay in their homes or telling schools to make sure the kids don't really mix with anybody outside of their own home and outside of their own classroom, we get a tier 3 lockdown where people who otherwise would be making money going up to Christmas are now incapable of running a business.
Well, yeah. Well,
I mean, it's not good, is it?
It's not good. To be fair to everybody, we've only known about this virus for less than a year, right. And we've learned very fast. And one of the things we've really learned very fast is what a tricky customer it is to control. And of course, the downside of that is that we have brought in drastic controls, which have in themselves caused a lot of harm.
Right.
And the one thing I mentioned so far is the harm to the NHS, not because of the problem of treating COVID patients, but because that takes priority over treating people with cancer and heart disease and all the and strokes and all that kind of stuff. So, we're in a right old mess. And let's hope that we do get a grip on the virus through the vaccines, which are going to be rolled out next year.
Yeah, but
let's
the vaccine that we currently have, Hugh, doesn't stop you getting it, doesn't stop you spreading it, and doesn't stop you self-isolating if you're told to.
Well, we don't know yet. Let's wait and see. What it does is it protects lives, and it protects the NHS in the sense that fewer people who've had the vaccine will get ill to the point where.
I think that's a great thing. But that's what they should be pressing. That's what they should be pushing. They shouldn't be going on about how vaccines just about 3 weeks ago were the answer, and as soon as we get a vaccine, we'll be able to return to normal. Now they're saying that's actually not true. And I think they're getting the message wrong all the time, consistently getting it wrong, trying to frighten people, trying to ensure that people don't do anything. There's already now talk of people not mixing properly at Christmas. You've heard from Nicola Sturgeon, who really ought to spend a bit more time on the drug problem in Scotland, rather than telling people that they shouldn't hug their granny or they should not actually bother having any potatoes to share. This is a woman who's become obsessed with the power that she's got in order to push everybody around.
Well, yeah. Well, that's the nature of politicians, isn't it? They like pushing.
Yeah, but
people
we
around.
pay them; they don't pay us, right? We should stop listening to them.
They'll all be judged at the end of the day on how well they've succeeded, and so far, none of them have done as well as they could have done. The only politicians in democratic countries who've done really well is in New Zealand.
Yeah.
Now, of course, they had the good luck of not having very many cases imported.
Yeah, but New Zealand is the sort of the human equivalent of a hamster cage. There's hardly anybody there. You can't really take any notice of them, can you?
Oh, well. Quite a bit of the evidence about outbreaks comes from New Zealand because they had a very good track and trace system there, and we know about the danger of meeting in large groups in an unregulated way, close together, no social distancing is a good way to spread the virus. And quite a bit of the evidence comes from New Zealand on that because they were very good at recording it.
Yes, but isn't it time, Hugh, that we actually started looking at this in a different way? And I know I've asked you this question before, but, people are going to mix, right? People are going to see each other. People are going to be on the tube together. People are going to be, out on the streets together. People are going to be in their homes together. Christmas is coming. The idea that we somehow can stop all that is a nonsense, isn't it?
Well, that's why we have a lot of virus.
Yeah, but we don't. Yeah, but we have a lot of virus. But we don't have any bigger numbers of deaths than we had back in March and April. And so, maybe we need to take that on board as well.
That's because most of the virus at the moment is in people who don't have a hard time with it.
Right.
But
so what's the problem?
Well, we'll see what happens with hospital admissions and all that kind of stuff. Yeah, but
that's what you guys keep saying. And it never has happened that the NHS has been overwhelmed. It's never happened.
No, we made plans and, double the capacity for ICUs and all that kind of stuff.
So there's no problem?
Well, there is a problem because a lot of people have died, particularly people in care homes.
No more people have died, Hugh, than have died every single year at the same time of the same and different diseases. There's no bigger increase in the numbers of people dying than there were last year or the previous 5 years.
No, the problem is that people have died who otherwise wouldn't have died because they were killed by the coronavirus. And, that's what.
Well, why has that not been reflected in the numbers? Why are there not more people dying than would normally die?
Well,
you can't answer it, can you?
Yeah, well, yeah. I mean, statistics, lies, damn lies, and statistics. Basically, we have to be very careful about looking at excess deaths, which we had a lot of in the first wave. Not so many this time, because we're better at treating the virus. Wow. Because most of the virus this time, unlike the first time, is affecting younger people who, generally speaking, have an easy time, don't even get into hospital at all.
Right.
A few of them have this long COVID and all that kind of stuff, which is obviously very distressing. But so far, we've been lucky in that we haven't had that big surge of deaths. There have been quite a lot of deaths, and there are big care home outbreaks running at the moment, killing people. And, my aim would be to prevent the preventable. And we are doing some of the prevention, but we're not doing as much of it as we should be.
But let's not waste time and money on preventing the unpreventable. That would be my view. Professor Hugh Pennington, Emeritus Professor of Bacteriology at Aberdeen University, thank you very much indeed. Very revealing, that, I think. We'll talk about that some more coming up after this.
Talk Radio.
Some more people about the hospitality problem in this city in London right now, and also in the rest of the country as well, because there is a massive problem. Let's, though, first get some news headlines. Here's Jenny Barsby.
Talk Radio. Half-hour headlines.
The government's coming under increasing pressure to think again about relaxing coronavirus restrictions over Christmas. 3 households are being allowed to meet up anywhere in the country for a 5-day period. A joint editorial in 2 health journals is warning the NHS could be overwhelmed without a U-turn. Greenwich Council in London has backed down and told its schools to stay open until the end of term after being threatened with legal action by the Education Secretary. Its leader, Danny Thorpe, has released a statement saying he has serious concerns about Gavin Williamson's order, but can't justify using public money to begin a legal challenge. An Ofsted Chief Inspector, Amanda Spielman, is suggesting the government is in the right.
It's so tempting to think it's just a day or two, it won't make much difference, but actually multiplied across all the children, there are huge numbers of children in the school system, it actually adds up to an extraordinarily large amount of learning time when you close schools for a day or 2 or 3.
Meanwhile, there's been a drop in the number of deaths in England and Wales, which mention COVID-19 on the death certificate. 2,835 were registered in the week ending the 4th of December. It's down 7% on the week before and the first fall since September. Latest figures show a record 370,000 people were made redundant in the 3 months to October. Since February, 819,000 people have lost their jobs, taking the unemployment rate to 4.9%. Greg Thwaites from the Resolution Foundation has told Talk Radio there's only one solution, and it won't happen quickly.
Ultimately, in order to improve the economy, we're going to have to control the virus. And you can see around the world, countries that have controlled the virus better than we have had better outcomes than we have. So the Chancellor is absolutely right to continue to support jobs and workers until we improve the virus. But it's the virus ultimately that's the key to recovery.
And we're being urged to switch to reusable face coverings as it's emerged 102 million disposable ones are binned in the UK every week. Nearly 70% of those who wear one are unaware they're made of single-use plastic. Well, it's a mixture of sunny spells and blustery showers today. It'll be wettest in southern and western areas. Breezy but mild for December.
Across the UK, online, on DAB, and on your smart speaker. Late Night with Christo Fufas on Talk Radio.
Big topics, big opinions, big conversations, and a place to have your say. So phone Christo and let's put the world to rights.
Late Night with Christo Fufas. Weeknights from 10 on Talk Radio. Mid-morning with Mike Graham. Talk Radio. The independent republic of Mike Graham on Talk Radio.
Now, isn't it interesting when you talk to people who are otherwise quite sensible? And Professor Hugh Pennington, make no mistake, is a very sensible character. He's a very good guy and he knows what he's talking about. However, when I said to him, isn't it true that actually we are not seeing any big numbers in terms of people dying from COVID-19 at this particular time than we would see at any other year of this particular time of year? So for the last 5 years, it's been true to say, if you compare the numbers, we are not seeing massive numbers of people dying from COVID-19. It's just not happening. Now, you might say, as he did, that they're dying from COVID-19 and they wouldn't otherwise have died. But equally, that is in question because we have all sorts of doubts about some of the ways that the data is being collected. If you have got a COVID test and you test positive and you die within 28 days of that test, you are said to have died of COVID, which may or not be a complete and utter crock. You may not have died of COVID. Instead, what's happening is the government is using this data and shutting down businesses all over Britain, not just in London. And for those of you who still think that I'm only talking about this because it's happening in London, you know, you should have been listening to the show for a long time because you would know that I have been banging the drum for the hospitality business for a very long time. Not just about London, not just about Manchester, not just about Plymouth, not just about Glasgow. You know, one of my best friends runs a nightclub business in Glasgow and I talk to him on a regular basis about how awful the situation is. And we're going to talk now to Adam Kiri, Managing Director of Camden Town Brewery, who have been particularly agile at trying to continue to make money, trying to continue to make their products available to people. But it's very, very difficult. And I don't think that the government has taken into account enough of the worries of modern day businesses, particularly when it comes to the food and drink sector. Adam, a very good morning to you. Welcome.
Good morning. Good to be with you, Mike.
Yeah, thanks a lot for joining us. I mean, you guys have been quite innovative in terms of how you've been able to sort of deal with all the various slings and arrows that have been thrown at you. With this latest lockdown, Tier 3, what are you doing?
It definitely does feel like we're constantly under attack.
Yeah.
And I think it's been a huge challenge for the whole year for us. What are we doing at the moment? I mean, right now, where I guess we're reaching out to our customers and just trying to understand exactly where they're at. You know, one of the real challenges now with the current sort of moving up to Tier 3 or sort of pseudo lockdown as we're having is just the complete lack of preparation we've been able to have for it.
Right.
So, as of Monday, yesterday we had pubs ringing up wanting to buy beer from us that would be delivered by the end of the week, and obviously now they're turning around and not wanting that.
Right.
But they're also turning around and saying, well, can you take the beer back that we've got currently in our cellars? And that's one thing that we could potentially help with as a business. But actually, you start thinking about all of these pubs that have just spent the last month trying to work out how to create substantial meals and make sure that they can sort of follow those lines. And again, they've now got freezers and fridges full of food that they're also throwing away. Pubs right now are in a huge amount of pain. And I think this latest change in tiering, whilst I understand the absolute need to get kind of society safe again, it's really going to have a huge impact on the industry.
Yes. Well, I mean, listen, I think, Adam, we would all agree if this is all about making people safe and saving lives and all of that, it would be understandable and we would all go along with it, much like we did at the start of it in March and April when we didn't know very much about what was going on. But I think now, increasingly, we look at all the lockdowns that have already happened before and we're going, well, really? Are you sure that this is even going to work? I mean, that's the problem, I think, isn't it?
Yeah, I do agree with you. I think, kind of obviously we're seeing a spike of cases in London right now. But actually, when you start mapping back of when those cases were probably transmitted, it was most likely during the last lockdown when you didn't have pubs open. And, obviously there are data that is being tracked by the ONS that are talking about kind of where transmissions are happening. And they rarely cite the hospitality industry of having anything more than 2 or 3% of transmissions. So it doesn't feel like hospitality is the problem. I obviously understand the logical sense of, well, if people are socializing together, then that must be where the virus could transmit. But I think what that does is that takes away all of the work that the hospitality industry have done to try and make sure that their venues are safe. So whether that's by spreading apart the tables more, increasing sanitization, making sure they're doing the track and trace side of things. I think they're doing so many things that actually means that probably being in a pub and having a nice meal with your friends is a much safer thing to do than potentially being at home in the back garden with a bigger group of people.
Well, it does seem to me that if you're going to, as we are now doing in Tier 3, leave the gyms open, there are much more likely places to catch it than anywhere else, really. I mean, the idea that the virus can sort of stay on pieces of equipment, that it can stay on various surfaces for quite some time, maybe 24 hours, maybe 72 hours, we're not sure. It just doesn't make any sense to me. I mean, I was in a restaurant yesterday. There were screens everywhere. All the tables were distanced from one another. There was nobody at the bar. If you wanted to go to the bar, you had to put a mask on to walk there. It's about as safe as an environment as I can imagine.
Yeah, I agree, and I think it's about regulated environment. So I'm sure that the gyms are doing amazing things to make sure their equipment are safe as well. But what you have is you have these regulated environments like pubs and restaurants that understand the virus, they understand how it's transmitted, and therefore trying to do everything they can to contain it. But what we actually know is places like schools and places like homes are where kind of obviously people don't have the same level of skills and understanding and knowledge, and they can't do that same regulation. And so that's the real challenge. I don't think hospitality is adding to the problem. I think it can actually be part of the solution.
Yeah. And as far as your business goes, Adam, I mean, you're a brewery, so presumably you have to ratchet back now on whatever your daily production would otherwise normally be.
Yeah, exactly. So, just going back in history, it still feels so long ago, but at the beginning of the year, we started growing. We were growing at 57%. So we had an amazing start to this year. we are now absolutely going to be in a loss. We will also be in a loss in terms of, from a commercial perspective, in terms of money side of things. And it's been hugely challenging trying to I guess, second guess the decisions that the government are making, and then also kind of work out how we can respond to that to limit that impact on our business. People probably don't generally think about the fact it takes 4 weeks to brew a beer. So, we're making decisions 4 weeks ahead of time. And of course, 4 weeks ago, things were looking a little bit more optimistic. We were heading into Christmas. Everyone had, I guess, some level of, okay, it's not going to be the Christmas we knew we normally have, but we'll have some Christmas. I think now we're all fairly resigned to a Christmas that won't have very limited social interactions. And so that means for us, we will be putting as much beer as we can into storing tanks, but fundamentally, ultimately, they will end up going down the drain.
That's really sad, isn't it? And have you managed to sort of sell any cans or beer sort of into supermarkets and stuff?
Yeah, I think, absolutely. Supermarket business is booming for us and for anyone that's selling into that sector. But I think when you look at the supermarket shelves, most of the beers on the supermarket shelves are made by the big four brewers. And so they're the ones that I guess had some really good gains out of that. A lot of the smaller, I don't necessarily include Camden in this, but a lot of the independent smaller brewers only sell to pubs, and they are really struggling because they don't have those options. Yeah, so in our case, our supermarket sales are up about double, so 100%.
Right.
That still doesn't go anywhere near the losses of what we lose from having the pub sector closed.
No, I mean, that is just dreadful, and I feel for you guys. And so, particularly without knowing when the end of it is, because this current Tier 3, we don't, I mean, all right, is that on December the 22nd or the 23rd, you're allowed to do some stuff with your family, supposedly, according to the government. But presumably for you guys, it's not really worth sort of winding in and winding up the whole production again for 5 days, because people are going to be off.
No, we're taking an approach now that we're not going to see any level of normality, anything kind of better than Tier 2, until at least sort of April time next year. And that's the generally thought of the industry. And then kind of coming out of those tiers potentially by June, July. Yeah.
And have you got a Christmas brew going out this year?
No, we, again, kind of these are the sort of things we've limited back on. We have got a beer of the year, right, and we do this every year to celebrate kind of how great the year has been. It feels very sort of misplaced this time, and I guess we're now sort of.
Imagine you're doing a bitter for this year, then, are you? Since it's not been very good.
Yeah, maybe we should. No, it is a Pilsner, but it's been brewed in wine barrels. It's been sitting in wine barrels all year, so it has a really amazing, nice kind of almost champagne-like flavour to it.
Okay.
So yeah.
And what's that? Where can you get that?
Easiest place is on our website, camdentownbrewery.com.
Okay, brilliant stuff. Adam, thank you very much indeed. Adam Kiri, Managing Director of Camden Town Brewery. Another example of a decent business which the government is literally trying to ruin step by step, trying to make it difficult for them to make any money at all, which is entirely wrong, in my view, isn't it? How about this from John, who says, "So, you have become a COVID denier and you support the view we should just let the virus rip throughout the country. I take it you will not be having the vaccine either." Well, listen, John, here's the thing. Let me explain something to you. There is a difference between denying that COVID exists and understanding that COVID exists, okay? I have never denied that COVID exists. I know lots of people who have had it. I know lots of people who have suffered as a result of having it. I don't personally know anybody who has died, but I know that people have died. Of course, I'm not denying the existence of the disease, but you cannot sit there and tell me that there's only two choices. Either you deny that it exists, or you absolutely believe that it exists, and you must shut down the entire economy as a result. That is the wrong way to think, John. And let me explain something else to you. If you have any regard for the economy of this country, you would, like me, expect people to be given the right to make a living. You would expect, like me, that the vulnerable people in this society will be protected. You would expect, like me, to have a government which is responsible not just for those people who are dying of COVID, but for everybody else in society, so that society can be successful, so that people who have put their hearts and souls and money into businesses are not completely and utterly run into the ground as a result of boneheaded ridiculous scientists who don't seem to think that walking around is a very good idea because something might fall on you. I mean, give me a small break. 0344 499 1000 is the number. Don't forget, we are live streaming on YouTube. We are live streaming on Facebook. We are live streaming on Twitter. You can watch us in all sorts of different places. Get on it now. This is Talk Radio.
Across the UK, online, on DAB, and on your smart speaker. Talk Radio.
I'm indebted to Kieran, who sent me a tweet in which he says, Mike, toot sweet is French, not Spanish, for future reference. Yeah, thanks, Kieran. Do you not think I knew that? Do you really think that I said Spanish in order to wind you up so that you would tweet me? Or was I wrong? You'll never know. Trust me, I did know that toot sweet was actually French. Sometimes I say things just for effect. Do you know that? 0344 499 1000 is the number. Let's talk to Shelley in Milton Keynes. Hello, Shelley.
Hi, Ash.
How you doing?
Yeah, wonderful.
Good.
Living the dream.
Good. Living the dream. That's what they say in prison, apparently. I read a story about that at the weekend. And apparently, when people run into each other in prison, they go, "How you doing?" And the other guy goes, "Yeah, living the dream."
I'm not quite there yet. I might be by next year. Not quite.
Excellent. What can I do for you?
Event companies. So hospitality, everyone knows because they can physically see that they're shut.
Right.
But events companies are probably the biggest casualty so far, I would say, along with theatres, of the coronavirus, because it has been illegal to do any events over 30 people, now over 6. No support whatsoever.
Right.
So if you've got a home-based business, you get no support. If you've got a large business, you can't really afford to stay open anyway because you haven't got the work coming in and literally just been forgotten about.
I spoke to someone actually, I think a few months back, who had unfortunately literally just launched a wedding sort of entertainment business up in the northwest. I think it was somewhere in Cheshire, and they literally had only just really launched a company when the pandemic hit, and they hadn't been able to do any business at all.
No, we've done nothing. The last event we did was February the 12th.
Right.
That was the last event.
And what sort of events did you used to do?
Sports hospitality.
Right.
So Formula One, football, large conferences, 600 people plus, overseas conferences. You can try and go online and do Zoom and all the rest of it. You know, people aren't interested. It's not the same.
It really isn't, is it? No.
No, it's not the same. It's all a bit laggy and a bit awkward. And to be honest, people don't really want to do it. People do want to get out there. And I'm sure when it comes back, I'm sure it will come back, 10 times over because people will be desperate to get out. But at the moment, the government has, given no support, regardless of what you think about the virus, and lockdown. The businesses should be supported.
No, sure.
Because there are going to be no businesses. And if there's no businesses, there's no tax. I don't know what's going to happen in March. Some people have been furloughed, some people can't. Some people have taken bounce back loans, which is just debt.
Yeah.
How are we going to pay this back? Come March, when we're at the end of furlough, how many businesses are there going to be that are going to remain?
Yes. And so how are you surviving, Shelley?
So deep pockets, savings.
Well, you're fortunate, but I mean that's not going to last forever, is it?
No.
I mean, do you know how long it will last?
No, I've been entitled to absolutely nothing. My MP, Ian Stewart, I've been on at him probably 60 times.
Yeah.
We've got the local newspaper involved. I mean, he's up in Scotland as well because he does all that. They just won't help. And some councils, it's a postcode lottery.
Right.
If you live 2 miles up the road, my friend's got an event company. He's just got a grant of $3,000 for a home-based business. If you live in Milton Keynes, they don't support home-based businesses. It literally depends where you live. And there needs to be parity across the board, from Cornwall all the way up to Scotland. If they're shutting down businesses, they need to give people support. If that's what they believe is the right thing to do, we need to prevent the virus, we need to stop the virus, locking down is the way forward, fine. But we need to support you because there's many groups out there excluded and forgotten.
Yes.
People have died since, suicide, since these groups have been set up.
It's absolutely right. And it's a shocking state of affairs. Shelley, listen, thanks very much for your call. Hopefully, we will see events coming back sooner rather than later. But it doesn't look as though anything's really going to change between now and, say, March or April. That seems to be what people are saying. So if you are out there and you're trying to make a business work, I really do feel for you. And if there's anything we can do for you, by all means, call us and let us know. Jeff is in Liverpool. Hi, Jeff.
Hi, can you hear me, mate?
I can indeed. What can I do for you?
Right, the distribution of the vaccine, way back in November, Matt Hancock said, military are on standby.
Yeah.
They haven't done that. What they've done, they've employed another private company, and what they've done is probably a friend of a friend of a friend of a friend within the cabinet, like the PPI, like the track and trace, and like the 4 million face masks, a friend of Richie Sunak's through Matt Hancock. I just think this cabinet are just feathering their own nest.
I mean, there's a lot of people. There's a lot of people making a lot of money, Jeff, aren't there?
Yeah, and it's wrong, Mike. Why didn't they use the military to distribute this vaccine?
Yeah.
They said they'd get it there on time, and it'll be done and dusted. Why? Because nobody's getting a bit of a cut if they go through the military, are they?
Well, it might well be the military involved in a bit of it, because I think they said they were, but maybe they can't do all of it.
Of course they can, Mike. This vaccine, right, it is allowed to defrost for 5 days.
Yeah.
It's not if we live on a big continent like America. We're only a small dot on the earth. And you're telling me they can't deliver this vaccine on time, and we only live on a small island?
Yeah.
It's an absolute disgrace, Mike.
Mind you, good luck trying to get across London in a lorry in 5 days, because I don't think you could.
Well, you could probably walk it, couldn't you, Mike?
Well, you could actually, yeah, absolutely right. It's a good point, though, Jeff. Listen, thanks for making it. Jeff in Liverpool says, who is actually distributing this stuff? Because what we've heard today and what we heard yesterday is that a lot of GP surgeries are not getting the vaccine, so they can't give it out, right? Which is a truism. We've also got places where they've had to cancel lots of operations and lots of appointments that people had made to get the vaccine because they don't have it, right? So it's not being distributed properly. It's not being distributed evenly. Some people who are expecting the vaccine are not getting it. And if you do get it, you do have to give it out within a specific period of time, because otherwise it gets too warm and it's ineffective. So, I mean, I'm sorry. If you are running this operation and you are sitting in Downing Street listening to this show, because I know you do, because you're always complaining about things that I say if you don't like them. So I know you're listening. Get your act together, people, because otherwise there is going to be one hell of a torrent of abuse coming your way. And I don't mean from me, I mean from the electorate, the people who put you in power, the people who gave you an 80-seat majority, the people who are sick to the back teeth of being told what to do by a bunch of scientists and people like Chris Whitty, right, who looks like the Mekong. I'm sorry, I don't want to listen to this guy anymore. I'm not interested. This is Talk Radio.
Talk Radio.
And welcome back to the Independent Republican Mike Graham right here on Talk Radio. We've had a very interesting conversation about a great many things throughout the course of the show so far, including, of course, what is going on. London's going into Tier 3 tonight, so if you haven't been able to go out and get yourself a meal, by all means go and do so before everything shuts down. And it won't be open again, really, until next week when they open up again, presumably, for Christmas. I don't know yet whether that's actually going to happen, but we assume because we're going to be given this 5-day grace period, presumably on the 22nd, 23rd, people will be able to open restaurants again. But if you run a restaurant, that's not really much help, is it? You've got loads of stuff now that you thought you were going to be selling between now and Christmas. If you run a pub, you've got loads of stuff that you thought you'd be selling between now and Christmas, which you now won't be able to do. It's pretty ridiculous, isn't it? 0344 499 1000 is the number. We've got some homeschooling coming up with Tom Whipple from the science department at the Times newspaper. He's a very clever man. He'll be telling us all about the new dinosaur that's been discovered. Also, of course, John Rentoul joins us in this hour as well, because we're trying to figure out what's going on with the Brexit negotiations. It's all got a bit quiet. Certainly Tier 3 was announced yesterday, and that's all anybody's been talking about. But presumably, they're still talking about Brexit. Are they? Aren't they? I don't know. John will tell us. 0344 499 1000. You're listening to me, Mike Graham, on the fastest growing radio station on the planet. It is, of course, Talk Radio.
Mid-morning with Mike Graham. Talk Radio.
So, notwithstanding the rigours of Tier 3, which we're about to enter, John Rentoul has been able to join us at a very unusual time for him. Normally he comes on around about 10 o'clock, but today we thought we'll just shake things up a bit and get him on at midday, just for a change. Chief political commentator at The Independent. John, welcome. Very good afternoon to you.
Hello there.
Thank you very much indeed for joining us. I'm going to start with the obvious question. What the hell's going on?
Well, the fact that we don't know, I think it's a good sign, because it's a bit like, do you remember the tunnel that these negotiators used to go into?
Oh, yes.
When they were engaged in the sort of detailed line by line thrashing out of the withdrawal agreement. First, Theresa May's withdrawal agreement, which got chucked out by Parliament, and then Boris Johnson's. This time, they're not talking about a tunnel, but the fact that they've gone quiet suggests that they are actually engaged in some real nitty-gritty of negotiations. I think they'll do a deal, as I think I said to you before. I think all the posturing about how terrible it is and how a no-deal outcome is the most likely thing to happen. I think all that is just a negotiating tactic. I think both sides are desperate to do a deal. They just need to find the form of words that they can agree on.
Right. Because, I mean, the last thing I think I read yesterday said that the team was staying in Brussels to continue the negotiations. But then I didn't read anything else. So I assumed that either they'd come back or they were still there. Because you can only have two outcomes, really, can't you? But, I mean, I think you're right. Clearly, I mean, Boris is operating this kind of, from afar business of, trying to make out that if there is a deal, it will be a last-minute deal. If there is no deal, it will be their fault.
Yeah, I mean, as far as I know, they're still there, and they are still talking. And we've heard hopeful signs from the EU side, and there was a bit of a kerfuffle yesterday. But I mean, that was just a sort of briefing mix-up where the Prime Minister's spokesman said that a no-deal outcome was possible, which sounded rather different from what the Prime Minister was saying.
Yeah.
It was very likely. But then a different spokesman for the Prime Minister got on the line and said, no, the situation hasn't changed. So, Number 10 is still trying to sell pessimism, gloom and despair. I think in the hope of being able to pull a deal out of the bag fairly late in the day, maybe not even this week. I mean, it could be next week.
Yeah, I mean, it's not as if they have to manufacture pessimism, doom, and despair, is it? Because I mean, that's how we're all feeling about the rest of the world at the moment. So they can just go along with that rather than actually pretending that things are worse than they really are. Because in the end, I think people are now so fed up with the whole Brexit argument that even people who are sort of really, really massive Ramonas are kind of just going, can we just move on now, No. If
speaking as a professional massive Ramona myself, I mean, I think...
You're not giving up.
I think the Ramona media will find lots and lots to complain about.
Well, do you know what? I was talking to somebody who knows an awful lot about these things yesterday, and he was saying that, it's all very well with the government going on about how, more or less the entire deal has been done apart from three things, because the three things that haven't yet been done are the three most important things, i.e. the fishing, the internal markets bill and the level playing field. Without those three things, the rest of it doesn't matter a fag end.
Yeah, no, that's right. But I mean, it's quite important that all the rest has been done, because I think that means that there is a text which is more or less ready to go. They just have to slot in the final paragraphs about those three things that you would. Which means that it can. I mean, unfortunately, that means it can actually be left to the last minute. It could go right up to the wire. I suspect there's a huge element in all this of politicians not wanting to have to be negotiating this stuff over Christmas itself.
Yes.
So I think there is quite an incentive for them to get it done before Christmas. But I mean, that does mean it could run into quite late next week.
Well, yes, because surely Parliament needs to scrutinise the bill, doesn't it? I mean, in the end, just in terms of actual practicalities, if it was to come in, say, on the 23rd of December, and they said, well, you've got 2 hours to have a quick look before you go back to your constituencies. I mean, is that the way it's going to be?
That is probably how it's going to be, Mike, actually, because, I mean, technically, legally, Parliament doesn't have to ratify the deal. The government can do that itself, but Parliament does actually have to pass some legislation to put the deal into practice before the 1st of January. Now that is going to be well, it's not a hold up, because Jacob Rees-Mogg, the sort of parliamentary business manager for Boris Johnson, has just given an interview where he suggests that he would ideally like 6 days to get that legislation scrutinised by Parliament, but it could be much shorter. And we saw with all that extraordinary constitutional toing and froing over Brexit in the deadlocked Parliament before the last election, how quickly Parliament can actually pass primary legislation if it wants to.
Right. And what about the whole kind of January the 1st deadline or December the 31st, whichever way you wish to put it? That, I mean, like every other deadline, presumably is a little bit liquid, because every single other deadline we've ever had has been a deadline that we have not bothered paying any attention to. Somebody actually tweeted the other day, perhaps we should just reinvent the definition of the word deadline. You know.
Yeah, it's not helpful to suggest that 1st of January is not a real deadline, because that will just give the politicians an incentive to run over it. I mean, it is a much more serious deadline in the sense that it is written into an international treaty, namely the withdrawal agreement, which means that if a deal isn't done by then we're out of the single market with no terms. So there is a hard deadline in the sense that it can only be extended by another international treaty.
Yeah.
The business of getting an international treaty approved does take a little bit of time, even though that can all be compressed, absolutely amazingly into a few hours. Right. I mean, but the sticking point is always going to be the European Parliament. They have to approve it all. Luckily, they're meeting remote and voting remotely, so they'll be able to do that.
Well, funnily enough, I heard their deputy president, I think, who's a Green Party person from Germany called Heidi, somebody or other. I can't remember her last name because I don't feel as if I ever should have to remember it. She apparently said that they would be willing to come back between Christmas and New Year if necessary to ratify the agreement. And she also said she didn't care what the agreement was, because as long as the negotiators negotiated it, they would be happy to sign it off, which struck me as a bit odd.
That is in effect what's happening. And when she says she's happy to come back, what she means is she's happy to get on her laptop and
get on Zoom.
Connect with Zoom to...
can you imagine, right? Isn't it great? Here we are with one of the biggest constructs of modern political history ending in a Zoom call. It's great, isn't it?
Well, everything else is on.
I mean, if that doesn't tell you that 2020 has been a very odd year, then I don't think anything else does, really.
Absolutely. I mean, on the other hand, there are quite a lot of MEPs who are kicking off a bit about the idea that they're expected just to nod it through on Zoom at the last minute and take it all as gospel, just because the European Commission has negotiated it. So there is a bit of tension. I mean, there was some stories around yesterday about some of the MEPs suggesting that they wouldn't agree with it, and they would just let us leave without a deal for a few days or a few weeks while they took their sweet time to consider it. But I don't think that is the official position of any of the parties.
No, I mean, if we did end up, John, with a no-deal scenario on the 1st of January. As the French fishing fleet sort of heads up towards the coast of Grimsby, what happens then?
Well, I don't know if they observe bank holidays in France. So they may wait until January the 2nd. But what happens then is that we could get into a tussle with Icelandic cod war scenes.
Yeah, I remember that. I used to enjoy those when I was younger. The old cod wars. That was great fun.
The thing about the cod war, though, actually, Mike, is that we lost it fairly comprehensively.
Well, listen. There's always another chance, and we can puff our chests out and wave a Union flag, and away you go, and we can maybe win these ones.
Well, we would have the law on our side. In that situation, but I think people would actually at that point be more focused on the lorry queues that will be growing, not just queues in Kent, but the queues of lorries to get into Kent, because they'll need a Kent access passport.
Will Kent still be in Tier 3? Is my question.
Probably.
I mean, life has become so ridiculous, right? That I don't care whether there are lorry queues. I really couldn't care less whether the ferries run. If they tell me at Ocado that they can't bring me any, lamb, mince or cheese, I won't care about that either. I think this is where we are now. We've now lived through this sort of horrendous year of nonsense that actually, Brexit and what may or may not happen is of no consequence whatsoever.
Well, I don't think you can dismiss it that lightly.
Well, I can. I mean, look at what we've been going through. I mean, I had to find, I've got all sorts of accounts now with various different wine sellers because I couldn't get any deliveries back in March and April. So I sort of signed up to all these various different companies that can now deliver me cases of wine. Life has changed dramatically.
Priorities sorted out then.
Well, I have. Yeah, it's absolutely right.
I mean, the main thing about lockdown, I couldn't get any strong wholemeal flour from my bread maker.
Right.
For months on end. So if Brexit means that's not available anymore, then I shall be very worried.
But I guess what my larger point, John, is that we're all a lot more kind of prepared, if you like, for things not working terribly well. Because up to March of this year, we were all very cosseted and we were all very spoiled, and we expected to be able to snap our fingers and get what we wanted. We now know that that's not the way the world works anymore because of all sorts of reasons. And so now, if you can't get your wholemeal bread made because you can't get the flour, if you can't get your fly spray, if you can't get a battery for your car, you just adapt and get on with it.
Well, yeah, I mean, people are prepared to put up with that kind of thing as long as they think it's temporary.
Yeah.
I think that's the real.
Yeah, and I think that's what it will be. I mean, if there is a problem, and the government has now started telling people, unbelievably, in my view, that there might be a few problems after all this, that people will consider it to be temporary.
Yeah, well, and I think that when come the summer next year, when we have vaccines and we can open up the economy, I think people will want to go back to how it was before. And the real cost of Brexit is obviously not going to be the short-term disruption. It's going to be the long-term economic disadvantage. And I think that will take years, if not decades, to sort of seep into the public consciousness. I mean, you've got to remember when we joined the common market, as it was then called. I mean, that partly because we felt we were falling behind the rest of Europe. Now, we haven't felt that recently, but if we do
we still have a better economic growth figure than almost every other country in Europe. We still have a lower unemployment figure than most other countries in Europe. We are, in many ways, economically superior to most of the countries in the European Union, particularly those which are poorer. So I don't share your pessimism about that. I think, actually, we're in pretty good shape, aren't we?
Yeah, no, but I think that's true. But I think that's one of the reasons why people were prepared to contemplate leaving the EU, right? Because they felt that we didn't need the EU to be a modern go-ahead economy anymore. But if we start to fall back as a result of Brexit, as we will inevitably suffer some long-term damage, because we will be making our trade with the world's biggest single market more difficult, then I think attitudes may start to change. But I mean,
well, we won't be, though. I mean, that depends on your point of view, doesn't it? I mean, you believe that because, as you say, you are a self-confessed massive Ramona. However, there are plenty of other people who will tell you that actually that's absolutely not a tosh. And in fact, we will be in a much better position because we can do trade deals with other countries which are not restricted anymore by the mass of the other 27.
No, well, I'm not a massive Ramona.
You said you were.
Yeah, but I was making fun of the fact that I work for the Independent, which obviously.
Yeah, well, that is a very funny newspaper, but that's another story. I don't wish to pour scorn on it for this height.
As I've always said to you, I've always been an extremely reluctant Remainer, and I do respect the case for leaving, and I think the referendum should be implemented, and indeed has been, and I think that's a good thing, because that's what the people voted for.
Yes.
I understand a lot of why they voted for it, but I do think this idea that we will prosper by signing buccaneering trade deals with Uzbekistan and goodness knows where else is just for the birds. There is an economic price to be paid for Brexit, and I accept. A lot of people were willing to pay that price, and that's fine. But for people who think that we're somehow going to be magically more prosperous as a result of Brexit, I'm afraid they've got another thing coming.
Yeah, well, I take the view really that not that much will change. I was asked the other day by someone, "What do you think is going to happen?" And I said, "Well, to be honest, we'll be standing here a year from now. Much of what we do now, we will still be doing. Most of the things we buy, we will still be buying. There won't be shortages of really very much of anything, and life will just go on. And if you're worried about prices going up, well, guess what? That's what they do. Prices go up all the time. And, I'm old enough to remember decimalisation, I'm afraid, which you may not be. And all I remember about that was that as a child, everything in the sweet shop went up because they decided that was a good opportunity to put the prices up. And same goes for Brexit.
That was when things started to go wrong, wasn't it, Mike?
I'm not dewy-eyed about the pound and the shilling and the florin. I'm really not.
But you're right that in the short term there won't be, or at least in the short term there'll be disruption. In the medium term, probably people won't notice very much. But in the long term, putting obstacles in the way of trade with the European market is not going to do us any good. I'm afraid
but we won't be doing that. They'll be doing that, not us, and that's the difference, isn't it?
No, we'll be doing it because we'll be insisting. Because by coming out of the single market and the customs union, you require checks to be done at the border, and that even if it only takes 15 seconds per lorry, that is like putting sand in the wheel of a machine. It's just not.
But hang on. When was the last time you crossed the Channel?
When was the last time I went to?
When did you cross the Channel?
England, I went to the France-England rugby match in Paris in February, just before the lockdown.
Oh, blimey! So you're a super spreader of COVID then, in that case. What about what happened to you? Right? Did you get stopped as you went over the border?
Yeah, my passport was checked on the Eurostar.
Yeah. Oh, so you're on the Eurostar. Okay. So if you go in a car, basically, you get checked at Dover, you get checked at Calais. Same when you come back, you get checked at Calais, you get checked at Dover. Same thing. Why is it any different?
Yeah, but we're talking about trade, Mike, and we're talking about goods coming.
But they can't just let lorries go across the border without checking them. Surely they shouldn't be doing it now.
There are more checks at the moment. After January the 1st, there'll be more checks that have to be carried out.
Well, I would say good. I'm very happy because if there's anybody clinging to the underside of the lorry, they might find them.
No, they'll be checking. They'll just be checking whether the rules of origin have been observed and all that.
Well, that won't take long. That's fine.
They won't be looking under the lorry. Anyway.
Well, I'm sorry. They bleeding well ought to be, in my view. Sorry, and I'm very happy that they'll be doing checks, and it won't disrupt much. It won't mean that there it will be for the first time queues on the M20 or queues at Calais. Because guess what? They've already got queues in both of those places.
No, there'll be more. There will be more friction in our trade with the European market. That's what all the economic models show. That's what the Office for Budget Responsibility suggests. That Brexit will lead to lower national income in this country because we won't be able to trade as freely as we can now, and that's just a fact. And it's fine.
Well, it's not a fact. It's produced by those Ramona civil servants who produce reports for the government, which always say that anything you do which upsets the apple cart will be a bad thing.
No, there are very few serious economists, whether they're Ramonas or Leavers, who don't accept that there is an economic cost to leaving.
I think you should have just left that sentence that there are very few serious economists, and I would have agreed with you. But there we are. John, thank you very much indeed. John Rentoul, Chief Political Commentator at The Independent, self-confessed massive Ramona, even though he's now denied being a massive Ramona, having admitted it in the first place. Wonderful man. Thank you very much indeed. If you've got something to say about this, as I'm sure you do, you know what you have to do. 0344 499 1000 is the number. This is Talk Radio.
Talk Radio with Mike Graham. Talk Radio. The Independent Republic of Mike Graham on Talk Radio.
Welcome back to the Independent Republic of Mike Graham right here on Talk Radio. Ian Collins will be here, of course, at 1 o'clock. He'll be in just before that to tell us what's coming up on his show. Dan Wootton will be here from 4. James Whale later on, of course, as well. We'll be filming Plank of the Week later on this afternoon as well. Carol Decker is coming in for that, the T'Pau singer. So it's going to be a bit of a star-studded scenario, I have to say. Pat is in Stepney. Let's have a word. Hello, Pat.
Hello, Mike. All right?
How you doing, man?
Yeah, I'm not too bad.
Excellent. What you got for us?
Well, 2 points, really, and I'll run them both into one another, and then you can answer them concurrently, like the judge said.
Indeed.
Yeah. First of all, it is my belief, not my knowledge, but my belief that this Tier 3 lockdown will be, probably by the end of January, the backbenchers and the Tory rebels will start getting on to Boris and start pressuring him into lifting us back into Tier 2.
Right.
because of we're London, basically. I don't mean that nasty to any other part of the country.
No, but I mean, London is one of the great cities in the world, isn't it?
Because we're that financial hub of the whole country, I don't think Boris will be allowed to lock us in for like what he's done to Leicester and other poor parts of the country. And that's what I think. I might be wrong, but that's what I think. They'll be pressurised into it by the end of January.
Yes.
And also, the guy you were speaking, is it John Rental?
John Rental, yeah.
Yeah, well, the thing is, what he doesn't really tell you is that it wasn't free trade because we had to pay £9 or £10 billion a year for that privilege.
For the privilege, yeah, absolutely right. Good point.
You know, it was never any free trade. That's a nonsense.
Yeah.
But you had to pay money into the club.
Yeah, you had to pay to be in the club, right? And now they want to punish us for leaving the club by making us pay even more.
Well, that's right. That's what I'm saying. Like, you know, so it was never ever free. You had to pay for the privilege of getting your lorries through without checks, but you still had to pay, even if we was like not aligned to the European Union, we'd have to pay tariffs. So where does that, you know, it was only paying tariffs by the back door.
Yes.
Basically.
Yeah, no, I think you're absolutely right. I mean, I'm hoping you're wrong about the first bit, because what I don't want to see is us sticking in Tier 3 all the way through January. I'd like to see them going to Christmas next week and then going, I'll tell you what, we'll come out of Christmas and we'll go back into Tier 2.
That's what I'd like, but you know you're dealing with, like, psychos, and you know you're dealing with control freaks now.
I can't believe that this has happened. I mean, considering why they're making it happen, considering that it's all about schools, it's all about infections in places like Havering, you know, which, as I said earlier in the week, is about as far east of London as France. I mean, you know, it's not even in London.
Yeah, that's right. And, well, it used to be Essex, basically.
Yeah.
But
they're welcome to it, to be honest.
The point of fact being is that, isn't it convenient that, I mean, where was the mutation part of the virus last Monday or Tuesday or Wednesday?
I don't believe a word of it, mate.
And basically, wasn't it convenient they rolled it out yesterday to scaremonger people? I'm not saying it didn't mutate. That's what viruses do. But why couldn't they come out with it last Friday? The virus mutated slightly before they rolled it. It's all psychological, playing with your head. And the thing is that these people, as I said, these people gone psycho now, and these people have gone lockdown mania, and they're control freaks.
Yeah.
And there's a new thing that I don't like to say it, but I call Matt Hancock.
Yeah, well, I mean, it's a very good reason for that. I'm glad you went that way rather than a possible other way, which could have been disastrous for all of us. Pat, thank you very much indeed. Let's get some news headlines. Amelia Cox.
Talk Radio. Half-hour headlines.
The government is under increasing pressure to rethink its relaxation of coronavirus restrictions over Christmas. Two prominent medical journals say ministers should follow more cautious examples set by Germany, Italy and the Netherlands. Dr. David Nabarro from the World Health Organization has told us the price of seeing friends and family over the festive period could be very high.
This virus likes people moving around. That's what enables it to spread. And I'd just be asking everybody thinking of meeting up with relatives at Christmas, just to ask yourself, is there any way in which you can not have the family get-togethers this year?
A London borough which told schools to close early for Christmas has been forced to back down after the government threatened it with legal action. The leader of Greenwich Borough Council says he has no choice but to ask them to reopen, though he cannot agree it's the right choice. In the last half an hour, the government has announced weekly rapid testing will be available to all secondary schools in England from next month. The number of weekly deaths linked to the coronavirus in England and Wales has fallen for the first time since the beginning of September. 2,835 people died in the week ending the 4th of December, down 7% on the week before. And the rate of unemployment has risen to 4.9% in the 3 months to October. A record 370,000 people were made redundant in the third quarter of the year. Meanwhile, 819,000 people have been removed from their company's payroll since February, with the hospitality sector feeling the worst of it. The weather: showers for much of the UK, some sunny spells for central and eastern areas.
Across the UK, early breakfast with James Max. on Talk Radio.
Join me every weekday morning from 5 a.m. I'll bring you all the big news stories of the day. And I also want to hear what you have to say. So join me bright and early, live from 5.
Early Breakfast with James Max. Weekday mornings from 5 on Talk Radio. Mid-morning with Mike Graham. Talk Radio. The Independent Republic of Mike Graham on Talk Radio.
Welcome back to the Independent Republic of Mike Graham right here on Talk Radio. It is that time, 12:30. We've had the news a little bit after that. Time to have the old homeschooling scenario. Now, some of you might think, well, our kids are still at school, so we don't need to do this. But some children are home. Some children have already broken up for Christmas, particularly in private schools. Some children may have been sent home for one reason or another. They were all going to be sent home from Greenwich this morning, tonight, but it turns out now that that's been overruled by Gavin Williamson. So sorry to take such a long time to get to the point. But Tom Whipple is here, science editor at the Times, of course, because he's the author of Get Ahead in Chemistry and Get Ahead in Physics. But he's got a fascinating piece in the Times today with a rather splendid picture as well of a dinosaur that up to now we didn't really know anything about. Ubirajara jubatus, I think is the way you pronounce it. Tom, very good afternoon to you.
Good afternoon. Hello.
Have I got that right, or did I was a bit stumbly over the word?
I was just thinking, preparing for this, one of the great things about being a print journalist is I never ever need to know how to pronounce it. I still don't. So let's agree never to use this word.
Okay.
Again.
All right. I'm going to go with UJ because it's got two. Got two initials, and that'll do for me. But it says "Sexy Beast, meet the hot dinosaur," and your piece, I have to say, is absolutely sort of dripping with innuendo because you're basically saying that this was rather a sexy little beast of a dinosaur. Tell us about what's new about it because we didn't know about it until just now.
Yeah, so we think of dinosaurs as being these ferocious things that go about eating stuff, but of course they are the full gamut of evolution applied to them, and they filled all of their niches. And also we know that birds are the descendants of dinosaurs. So it's not too surprising to find a little dinosaur that behaves a lot like a bird, but that's what they found, and it's a really strange dinosaur. It was exquisitely fossilized. There is a very unusual fossilization where it managed to be preserved in salt and then preserved in rocks. They've got all this detail. And you can see it's got a mane that went up its back that it could lift and raise, a bit like a peacock's tail. And it's got these very strange protrusions out of its neck, a little bit like dried spaghetti coming out of its neck.
Right.
It looks preposterous. But the interesting thing about this is that we know that very strange, preposterous things can happen, like peacock's tails. And this tells us this is a very odd thing, if you think about it, to evolve. A peacock's tail is extremely inconvenient for a peacock trying to live its life.
Yes.
And it's something called sexual selection. We're used to natural selection. We're used to the idea that, you have these advantages conferred by evolution that mean you can survive better. But sexual selection is just insane. It's so in peacocks, which are the classic example, at some point a peahen decided she quite liked extravagant tails. So she mated with a peacock who had an extravagant tail, and they had sons with extravagant tails who then mated with more peahens, and this strange feedback loop where they just selected for more and more and more and more ludicrous tails. And you see it in lots of birds, and it seems we see it in this UJ, this small bird-like dinosaur with the crazy ruff and the crazy mane. And
right.
It's exciting to see it this early.
And it was discovered in Brazil, which would suggest, I suppose, that it was part of that continent rather than part of our continent. But would it be the case that it might have been elsewhere?
Well, the continents were in completely different places back then. And they've all come and met up and moved apart at different times. But there have been small things, probably like this, probably very similar, all over the world. The thing about fossilization is it's phenomenally rare. The chances are there isn't an existing fossilized human around. If humans became extinct tomorrow, it's quite possible we'd need no fossil evidence at all. It's very, very rare. It's only that the dinosaurs lived for 250 million years that we have any fossilized dinosaurs at all. So, there's quite possibly There will be ones doing very similar things, small, colourful, interesting, all over the world. This just happens to be one of the very few that we've found.
Because I was in the Isle of Wight recently, and there's a famous beach there where apparently you can find fossil footprints of dinosaurs, but I wasn't able to find them, and I was told the tide wasn't out sufficiently far. So sadly, I missed that particular opportunity, so I'll have to go back again and check it out. But I found it interesting from what you said about the whole sexual selection thing, because I was talking to an expert the other day about insects, and apparently the stag beetle lives for quite a long time in all sorts of different kind of metamorphoses, and then when it becomes a stag beetle, it literally only becomes a stag beetle to mate for 2 weeks and then dies because it's so cumbersome that it can't feed itself. And you just find yourself going, that's amazing, right? Science is just incredible.
There are lots of animals like that. There are cicadas that live underground in semi-hibernation for 7 years. There are others that live underground for 13 years. And they come up for a few days, a few weeks. They don't feed. Mayflies are the same. That they exist. I mean, look, ultimately, and as homeschooling, ultimately, this is all about sex. That's all we're about. We're about reproduction.
Yeah.
I am an ambulatory bag of flesh designed to reproduce the DNA inside me.
But tragically, for most of humans, once that's happened, the rest of your life just disappears and dissipates down the drain, doesn't it?
Well, exactly. Look, I exist for long enough to raise my children so that they too can reproduce.
Yes,
but
and then you're done.
That's it.
I can attest to that. Unless you get a job on the radio or something, you're useless. Nobody wants to talk to you. Nobody's interested in what you've got to say, and basically, your life might as well be over.
Yes, well, exactly. And we don't even have the amazing adornments of this dinosaur to fall back on with pride.
No. And this is great news, I suppose, as well, for those who like to make the connection between the bird community as it now is, and because it's got a very bird-like sort of beak, hasn't it? It doesn't look like a dinosaur, really. The rest of its body does, but its head looks just like a bird's head.
Yeah, it does. I mean, if you watch a chicken walking, you can imagine the noble Tyrannosaurus Rex it used to be. You really can see in the gait and the stride of these animals. You really can see the dinosaurs that they were. And we've found feathers fossilized in dinosaurs. This has been one of the big revolutions of the past 20 years. The realization that they weren't just these lizard-like things, that actually they formed the sort of animals we see today, and they look very similar. It's called convergent evolution. And you know, then they did survive. The dinosaurs did survive, but they just survived as birds.
Yes, and the word you use a lot in this piece is theropod. What does that mean? Theropod.
It's a particular group of dinosaurs that sort of stood on two legs and that looked a little bit like a chicken without wings or feathers, and could be a lot bigger and could be quite ferocious and eat things.
Nice. Very good. Well, very interesting as ever. Thank you very much indeed. Tom Whipple, Science Editor at The Times. A man that's always got something interesting to say, regardless of what I told him earlier about the mating process. Because it is true, though. Most sort of animals have this kind of reason to be, which is basically to mate, to produce young and offspring, and then to raise them so that they can do the same. That's what happens, I'm afraid. Luckily for us, however, we have higher and much more mighty things to do. Coming up, it's going to be Ian Collins from 1 o'clock. We'll take some more of your calls, 0344 499 1000. Don't forget, look out for the podcast a little bit later on, and look out for Plank of the Week a little bit later on as well. We're streaming on YouTube, on Facebook and on Twitter. This is Talk Radio.
Online, on DAB and on the Talk.
Welcome back to the Independent Republican Mike Graham right here on Talk Radio. Ian Collins will be here, of course, from 1 o'clock. And coming up at 4, Dan Wootton's not here, and so Mark Dolan will be filling in for him very adequately, I'm sure. That didn't sound right, did it? I said adequately. I meant brilliantly, obviously. You know, adequate's not a good word to use. Sorry, I apologise. Let's talk to Carol, who's in Hull. Hello, Carol.
Hello there, Mike.
How are you?
Yeah, not too bad, thank you. I heard you speaking to someone earlier on in the programme about gyms.
Yes.
Well, I'm just on my way there now, and they have a very strict cleaning regime. They have PPE on the staff when they're cleaning.
Right.
We as members, after we go to the Clinell wipes and we wipe down the equipment before we use it.
Okay.
And They have a timetable of every couple of hours. They go with a special solution and clean it, and then someone follows them and disinfects it.
Right.
And I feel safer in the gym than what I do in a supermarket.
Okay. So if you go there on a regular basis, then would they limit the number of people that are allowed in at any given time?
Yes, they do. I am on an off-peak membership anyway, and so they check how many people are in,
Right.
And they sort of like know that whoever's in the gym at a certain time, if there was ever cause for concern with anyone, that QR code, then they get in touch with you and things
Right.
like that. So it is very... The gyms
So it's very safe.
very
I mean,
well run.
so that people understand the context, I was saying that, surely you could catch COVID in any number of places, including in a supermarket, including in a gym. But why in that case would they shut down? I don't know what tier you're in at the moment in Hull. Is it 3?
We're in tier 3.
Oh, we are. Okay. But, I mean, so you can't go out for dinner. I mean, what's wrong with going to a restaurant?
Well, this is exactly what I say. This government have completely trashed the economy.
Yeah.
They need to bring them down to the Humber and throw them from the Humber Bridge and plonk them in.
Yeah, good idea.
That's what they need to do.
Absolutely. That's the best idea I've had all day, Carol. Thank you very much indeed. Carol in Hull saying that gyms are very safe, very good environments because they clean everything very well. But listen, I'm glad to hear that, and I'm glad that people can still go to gyms in Tier 3 because don't forget, when they first put Tier 3 restrictions into Liverpool, you weren't allowed to go to a gym. They've seen the light there. So obviously the science is not necessarily the science that they describe, because if gyms couldn't be opened in Liverpool, why is it that they can now be opened in Hull and various other places? The reason is the government have changed their mind. They've changed their policy because they've realised that actually it's a better idea to let people go to the gym, because in the end people want to stay healthy, people want to stay fit, and people have got nothing better to do. But in the same way, why can't they keep the restaurants open? Why can't they keep the pubs open? I don't know any pub or restaurant that has been in any way acting outside of a sensible activity, if you know what I mean. Let's talk to Carl, who's in Purley. Hello, Carl.
Hello, Mike.
How are you doing?
Just a thought on these weak MPs and weak parties of all these weak people that can't make a decision. Earlier on you said change the meaning of deadline, was it?
Yeah.
Is that what you said?
Yeah, I did, yeah, because the deadline word means nothing now. It means absolutely nothing.
Well, my mind went back to 1939. I wasn't around then.
Right.
But if the so-called weak Prime Minister of this country, Neville Chamberlain, had not kept to his deadline on that Sunday lunchtime, where would the world be now?
Well, it's a good question.
I mean, number one, me and my brother wouldn't be here.
Right.
Millions of other people wouldn't be here, but millions of other people would be here because my mum and dad certainly wouldn't have met. They met because there was a war on.
Yeah, right.
So did millions of other people. But that Neville Chamberlain, they accuse him of this, that and the other. He was weak. Compared to this crowd now, can you imagine?
I know.
If we came into that situation now, what would this lot do?
Well, if we had a real crisis on our hands, which I don't believe we do have right now, because I don't believe this is a crisis. I think they're making it into a crisis, but it's not actually one. I've got no idea how useless they would be.
If you was at school and the teacher said, do that again, you're going to get 6 on your backside from a big bit of wood, what would you do? You'd think, right, okay then, fair enough.
I won't do it.
They change every day. I'm sick to death of it. I'm almost turning it off now. They
I know.
change their mind in the minute. They go, yes, you can do, but no. Did you hear the mayor this morning talking about this lockdown in London?
I didn't, but I mean, generally speaking, I try and avoid listening to Sadiq Khan because he winds me up too much.
You should listen to him because he changed his mind about 4 times in the same sentence.
Right.
It was a typical lawyer speaking.
Right.
And at the end of it, I thought, well, what did he just say? What's the point of having him on? What did he say?
Well, this is the thing. I mean, somebody pointed out to me that a few weeks ago, right, you were able to go to the pub with 6 people, but you couldn't have 6 people in your house. Now, it's the opposite.
I don't know.
Right? And you're going, well, hang on a minute. Why did it go from 14 days to 10 days suddenly in quarantine? As the virus suddenly changed? No.
What you said lit up. It wasn't a light bulb. It was an LED. It lit up in my head.
Yeah. Good man.
Was,
well, listen,
you should
Cole.
Really put that up you should put that up as a £100,000 question. Change the meaning of that word.
Yes. Well, maybe we'll get a new definition for deadline. Carl, thanks very much indeed. I mean, somebody actually did suggest it, I think, on Twitter, that they could now call the definition of deadline a conversation that never ends. Because that's where we are with the Brexit negotiations. Basically, nothing is changing, but yet they keep talking. For heaven's sake. 0344 499 1000. How about this from somebody who doesn't give a name? Can we get confirmation, Mike, on pubs and restaurants opening over the 5 days of Christmas? I've not seen this proposal anywhere. Also, I'm of the opinion that there will be full lockdowns in January, irrelevant of the statistics. I think this was decided back in November on the assumption that people will be breaking the rules. Well, I think it's interesting, actually, because I have no idea. Because when we were told yesterday, and as I say, I wasn't actually watching when the announcement was made. I saw it when I got a message from a couple of people. Oh, you're in Tier 3 now. And I was like denying it first. I was like, what do you mean? We can't be in Tier 3. They can't have decided that. I thought they were going to decide it on Wednesday. Because tomorrow, of course, is the day that they decide what tiers are going to change around the rest of the country. So I immediately assumed that obviously the tier situation, if it was going to change, would change on Wednesday. No. That was absolutely and utterly incorrect because, of course, Boris Johnson decided, we'll just put London into Tier 3. Now, there are reasons why some people think that we're being particularly London-centric because we work in London, we live in London, we exist in London. But no, I have been fighting this case for people all over the country. And if you've been listening to this show for a long enough time, you will know that that's true. Fighting for people in Dundee. We had a caller from there who's got a pub, who's losing $13,000 a month. We had a caller from Kenilworth who's got 2 hotels, who's losing the equivalent of about $20,000 a month because he can't get enough money out of the government and they won't let him open the place. We've obviously spoken to our friend Donald McLeod up in Glasgow, who hasn't been able to open his nightclubs ever since March. We've spoken to people who can't do events businesses because they're not allowed to. All of this is not being compensated. When you hear the government say, but, we're looking after people, we're making sure that they're not going to waste, we're making sure that they've got enough money coming in. Well, that's not true, actually, because most people who are getting money are not getting enough money. They're not getting anything like the sort of compensation they should be getting, because in the end, you cannot compensate people for work that they aren't doing. If you take in 10,000 quid a week and you run a pub, the government's not giving you that money. They're giving you 500 quid a week. Even you can work out that doesn't really add up, does it? 0344 499 1000 is the number to call us on. We'll be here all day, of course. Tomorrow, it's Prime Minister's Questions. I dare say Keir Starmer, I don't know if Keir Starmer is actually going to be there or not. I don't know whether he's still self-isolating the plank. But you can be sure that he won't have much to say of any interest. Ian Collins is here, though. Very good afternoon.
It's grim news, Mike. You know that soiree we planned in Southend over Christmas? We were going to sit in a beach hut for a few days. Yeah. Take a case of beer with us. Can we not
do that?
Can't do it now. No. Not according to not one, but 2 medical journals.
Do you know what I don't... But every time they put new restrictions on, I'm always puzzled because I never know what it actually means. I mean, my daughter's coming in from Dubai on Thursday into a Tier 3. Now, does that mean that she can't go anywhere else? She doesn't live here. So technically speaking, she's not bound by the rules.
By the conventional rules.
She's got friends in other parts of the country that she wants to see. I don't know what to advise her.
Well, I don't think anybody knows.
No.
I was talking to some neighbours of mine, and they had no idea what they were allowed to do.
I mean, for example, if we wanted to go and do the beach hut thing, if you sit outside the beach hut, is that all right?
If one of us sits outside,
one inside, one out. Yeah.
Which kind of, it will sort of slightly do away with the Morecambe and Wise nature of our break, Mike.
Yeah, I mean, I've had to cancel lunch that I was going to have tomorrow with somebody.
Yeah, that ain't going to happen, is it? It's not open.
Because there's nowhere to go.
I mean, so
fancy a sandwich in Hyde Park. It's not much of an offer, is it?
But even that, I think, would be iffy or fishy.
Yes. Well, you have to sit on separate benches.
You'd have to sit on separate benches.
Pretend you don't know each other.
Pretend you don't know each other, because otherwise you shouldn't be meeting. Because it's all right if you meet somebody you don't know.
But it's all right for Christmas, though, obviously. Christmas, not a problem. At Christmas time, everything stops and we all get to know each other again.
Well, unless these clinicians have
their way. If these idiots try and shut down Christmas, there's going to be a problem.
Can you imagine?
Oh,
it's
there's going to be a real problem.
I might be marching with Piers Corbyn by that stage. That's how
I heard you giving him a going over the other week.
Yeah,
it was very funny.
Yeah, I slightly.
I
like old Piers Corbyn in a curious kind of way.
Oh, really?
But much in the way I like Great Danes, you know.
Yes. There's curiosity value.
One too close to me.
Well, luckily you can't get them in anymore.
That's very true. That's very true. All of that and more coming up on the other side of the news, Mike.
It's all going to be fantastic stuff. We've got loads going on. Ian Collins is up next. I'll be back at 10 o'clock tomorrow.
Talk Radio.